Hello, YouTube. Hold on one sec. Let me get Facebook up and running here. Start the stream. Yes, we have started the stream. All right. Let's see here. There we go. We good? Oh, you know what? I got to turn that down. There we go. Hello, 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 my friends. It's Jill Osborne from the Interstitial Cystitis Network. It is Sunday, August 20th, and I wish you could look outside because we've got a hurricane going on. Now, I'm up in Northern California, and what's crazy is that it's pouring right now in Northern California. There's a fabulous live stream on YouTube called LA Flights, and they're broadcasting live from Los Angeles International Airport. And if you want to see the storm and what it's doing, that would be a really good place to go. But anyway, it is stormy here. I mean, it's cloudy here. We've had some rain and lights were flickering earlier. So we'll see what happens. You never know at this point in time. So my name is Jill Osborne. I'm the National IC Support Group Leader. My purpose in doing these meetings is to make you so strong, so knowledgeable, and so informed that no one can mess with you. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that there's no hope. I don't want anybody to tell you that you're going to live for the rest of your life in pain, because that is absolutely wrong. Remember, I had a doctor say that to me. I was in my first year with IC. I'd had no pain care for a year. My pain levels were astonishingly high. And I had to go to the emergency room 2 days in a row because my pain was so high. Hello, Elise. Hello, Emma. Nice to see you. We are simulcasting right now on Facebook and YouTube. But again, it's a funky, weird day. Connections are going to be strange. So we'll just, we'll take it as it comes right now. Facebook looks like it's having some problems. Anyway, what was I saying here? Oh, darn it. I'm sorry. I totally lost track of what I was saying. It'll come to me eventually. Well, I know what it was. Okay. So I had been to the emergency room 2 days in a row. My pain was insane. I could, when your pain is so bad that you literally can't, you can't sit, you can't stand. All you can do, you can't lay down. All you can do is pace. And those were the days that I was having way back then. And of course, I'm pain-free now. But back then, I had a doctor in the emergency room just flat out say, you're going to be a burden on your family. You're always going to be in severe pain. This is your life. Get used to it. And honestly, it was a wake-up call for me. It was a kick in the pants for me. And it was the first time that I really stood up for myself. It was the first time that I gave myself permission to kind of be angry and be assertive. And I went, wait a second. I have 3 college degrees. I have an award from the White House. I will prove you wrong, you son of a bitch. How dare you say that to me? And that is exactly what I said to him. And I went home and I started studying. I read everything I could about IC. I read absolutely everything. I started my first support group. I called IC Redwood Empire here in Northern California. Within 6 months, it was one of the biggest in the country. And what was shocking to me is that I really thought I was the worst patient, like in the country. But once I started meeting other patients, it was like, oh, wait a second, I'm really not nearly as bad as I thought it was compared to some others. And there's an advantage of being in a support group because it gives you context. And so anyway, the IC Network website is basically the product of all of that studying. And now 30 years later, that is what I do. I study every day to learn as much as I can about interstitial cystitis and pelvic pain because I want to help you get better. Now, how did I get better? A lot of people ask that question. Well, number one, we figured out what my subtype was or what my phenotype was. I did DMSO back then. I did every antidepressant you could do. I did hydroxyzine. I did everything they told me to do. Nothing worked. Absolutely nothing worked. What worked for me was pelvic floor physical therapy. Why? Because I am muscle driven. I am a muscle driven patient. And once we got my muscles healthy, things got a lot better. So that's my goal here is I want to help you. I want to open up some new doors for you, some new windows for you. I want you to get some hope here. I want you to know that you're not alone. I want you to get this hug. You know, this is the hug for online. You're not alone. We're here. We care. We want to help you get better. We want to help you enjoy your life again. We want you not to worry about the future, but be excited about the future. But it means right now we got to do some exercise. Now I got to tell you, I got some new glasses, and you're going to have to tell me what you think of my glasses. This is one pair. I'm kind of weird about it. This is the second pair. You guys will have to help me figure out what you think works the best. These aren't bad, you know, they're nice and mellow. And these are my happy glasses. These are my happy glasses because I want to be happy. And I hope you fill your days with happy things too, right? So these are my happy glasses. So I think I'll wear my happy glasses for a while. Now, normally when I do these meetings, I do a good little 20-25-minute educational riff and then take your questions. And I'll take your questions for as long as you have questions. Sometimes we go 5 hours, sometimes we go 2 hours. We are just going to take it as it comes. Now, do you have a wicked sense of smell? Can you smell things that other people can't smell? Hello, Angie. And do smells drive you crazy? Do you have super sensitive skin? Now, it's so interesting working with patients, because I work with patients every day pretty much, is when I ask them that question, they're always like, how did you know that? How did you know that? Hi, Betsy. How did you know that I have a wicked sense of smell? How did you know that my family laughs at me or they call me the super smeller because I can smell anything and everything? And they get annoyed with me, right? Because God forbid you want to light a scented candle. If you happen to have a wicked sense of smell, that can be a little challenging. So when you have nerve sensitization, central sensitization, which is part of our IC subtype 5 widespread pain phenotype. So who am I talking about? I'm talking about people who have IC, IBS, vulvodynia, TMJ, fibromyalgia. If you have 2 or more pain conditions, migraines, then you fall under a different diagnostic category called chronic overlapping pain conditions or widespread pain. Now, what is that? What that means is that we, because this is one of my subtypes, I have 2 subtypes, we have a very sensitive nervous system. We do. We do. And it means that it takes less stimulation to turn us on. We call it upregulation. So, for example, for somebody with normal skin, you could do this all day. You could even pinch them a little bit, and they probably really wouldn't feel it. But God forbid you find somebody who has really sensitive skin like me. Sometimes even just the barest touch can trigger discomfort. Why? Because the nerves in the skin are extremely sensitive. One of the things that is going on for some people is something called small fiber polyneuropathy. And that just means the nerves that are the tiniest nerves and the tiniest diameter nerves are upregulated. So if you happen to be in this group, it's not like you've got 10 different diseases. If you don't have a bladder disease and a bowel disease and a vulvar disease and a joint disease and fibromyalgia, you don't have this. And that's how I felt in my 20s. Like I really felt like I was being punished, and I really felt like I had all these really weird things happening, and I never understood the connection until all the nerve studies came out. And now we know that this widespread pain, central sensitization, is the equivalent of a nerve injury. It is a nerve injury. It is a nerve trauma. And I think it's important that you look at it that, well, number one, it's the truth. That's what the research shows. But number two, that You didn't do anything wrong. I didn't do anything wrong. There is no shame. There is no blame. It means that we were injured in some way, that our nervous system sustained an injury of some type. Whether and what that research shows is that for about 80% of the people that this happens to, who get these multiple pain conditions, there is a major physical trauma. And for the other 20%, there is a history of abuse or bullying. And, almost every day now, when this comes up, when I'm working with patients and we're kind of going through the subtypes, and I say, hey, so like, do you have a wicked sense of smell? Yeah. How'd you know that? You have super sensitive skin? Yeah. How'd you know that? Okay. Again, signs of central sensitization. And I explain that. And then it's like, okay, can you remember any event that you associate with the onset of your symptoms? Was there a trauma? A lot of you have had broken tailbones, broken hips, broken legs. I was working with one patient a couple of weeks ago who suffered a severe broken leg at 6 months old. And now here you are, decades later, and it's affecting everything. They've got one leg shorter than the other from the bone injury. They've got muscle issues because their hips are not level, and they've got long-term nerve issues from that original trauma. But there's also a lot of you who have a history of abuse. And it always, like, I always have two reactions to that. My reaction number one is absolute fury that as a child, patients were hurt. For God's sake, in humanity, what do they say? You always know, what's that quote? You always know how advanced a civilization is by how they care for the weakest, right? Children have to be loved and protected. They should never be hurt and abused, ever. And quite a few of you have shared that you grew up in the homes of alcoholics. And that when that parent was drunk, they were violent. So for those patients, your safe place was school. But as soon as you left school and had to come home, you started becoming more hypervigilant. You started becoming more anxious. The closer you got to home, the worse it got. And when you got home, that young child lived in fear. Listening, always listening. Because dad or mom, how much have they drunk? Are they starting to get violent? How can we hide from them? And I want you to know that you're not alone. I want you to know that it was never your fault. I want you to know that you're loved. I want you to know that you deserve a happy, wonderful life. And that as awful as that has been, we have the opportunity in this generation to change the things that happened that we didn't like in our past generation. I was saying this once. I had a cousin that I just lost who grew up with a very, very abusive dad. And I was talking to her one day and I was just saying, listen, hon, when it's time for you to have your family, you get to live the life that you want to live. You don't have to perpetuate what happened in your childhood. And she didn't really believe me. But we have the choice to live a better life and protect our children. So anyway, I guess all I'm trying to say is that none of this is your fault. You have done nothing wrong. I don't want you carrying any shame, any blame. Donna says here, verbal is almost just as bad as physical abuse. Absolutely. Donna, well said. Absolutely. Eddie says, as I see affected by the environment, I seem to get worse when I'm near the ocean. I'm on vacation with my family at the beach and suffering terribly. I'm going to have to leave them and go back home. Well, Eddie, I guess I have a couple of thoughts about that. You're flaring. It's very common to flare when you're on vacation. Number one, you traveled. Whether it was an hour in a car or on a plane flight, you traveled. And whenever you travel, you're going to potentially trigger pelvic floor spasms, things like that. So it's very common for IC patients to flare on vacation. So if you had a long car ride, anything at all like that, let's get back down to the basics. You got to use heat to relax those muscles. Put your feet up. If you have a muscle relaxant, go ahead and use your muscle relaxant like your doctor told you to do. If you've got your internal wand, I would not travel without my internal wand so that I can, if necessary, if I've got to fly somewhere, I know I'm going to go into pelvic floor spasm. I always do. It's always been that way. I will bring my wand with me so that when I get to the other end, take less than 5 minutes, I can get in there and really work on relaxing those muscles. So concept number one is, could you be having a travel-induced flare? Concept number two is, are you, if you're prone to allergies, are you in a place where your allergies would be potentially more intense? If that's the case, and you know that about you, then using an antihistamine might be particularly helpful, using an over-the-counter histamine. If you're swimming, in our latest magazine, the IC Optimist, where is it? Here it is, right here. So this is our latest magazine, the IC Optimist. And we have an article in here on swimming and how to swim safely without tweaking your bladder. And so, and also really all about how to handle seawater and lake water, because, that can be issues, right? So dive in with confidence, swimming strategies for IC. So that would be something to look at. Make sure you're not sitting in a wet bathing suit for a long period of time on the beach. If you get wet, that's great. Go ahead and enjoy your swim. But once you're done, get out, take your swimsuit off, preferably in private. Take a quick shower, wash everything off, and put a new swimsuit on that's drier and that's not contaminated with either lake water, ocean water, or pool water, right? So I hope that you don't go home, honey. Every IC patient needs a toolkit, a traveling toolkit. And my traveling toolkit, the number one thing in my traveling toolkit is this: body heat heating pads. Whenever I travel, whenever I drive more than a half an hour away, I always have a body heat heating pad on my belly. And let's just do it right now. So listen, nobody will ever know you're wearing a heating pad. Do you see how thin it is? It's fantastic. Take it. And the way you activate it is you pull off the back, right? You pull off the back. And what I do is I put mine basically right here. See that? I put it right there. But actually what I do is I put it on the inside of my pants. I find, for me personally, that using steady heat on my pelvic floor makes that trip better. And I've flown to England. How long was that plane flight? 12, either 8 hours or 10 hours from San Francisco to England in a wicked flare. And I had my muscle relaxant, but it wasn't quite enough. I brought my microwavable heating pad, thinking they had microwaves on plane. The stewardess her flight attendant was like, "No, we don't have microwaves." What she did was she gave me hot towels wrapped in plastic bags, and I used that. So anyway, Cindy said, "You've been a great help to me. I'm from West Michigan. I've been suffering with Hunners and pudendal. Referred to Ken Peters because of you. Had 2 guided nerve blocks, RFA in October." Yeah, baby. Ken Peters, one of the best in the world, master diagnostician. She said, "By the way, I asked him if he knew you, and he said, 'Of course I know Jill.'" That's great. That's great. Emma says, "I'm based in the United Kingdom. Your videos are so helpful. Could you talk about the medicine of Betmiga or estradiol tablets?" Actually, guys, so yesterday I finished our IC Awareness Month press release, and I was working on the IC Awareness Month website because that starts September 1st. And our theme this year is about misdiagnosis. specifically misdiagnosis of estrogen atrophy or misdiagnosis of pelvic floor dysfunction. So you will, let me grab that real quick. Hold on a sec. I can read that to you. So getting back to, here, hold on. All right. Let me just read this to you real quick. And then it will kind of answer your question, Emma. Okay. So I'm just working on the title. I want to have a really good title. So imagine being told you have an incurable disease that will leave you in severe pain, unable to work, sleep, enjoy intimacy, unable to eat or drink your favorite foods, and leave you virtually tied to a restroom for the rest of your life. Yet, for millions of women, there is no disease and the condition is treatable. Quote, many women have been told that they have an incurable bladder disease, interstitial cystitis, or bladder pain syndrome, when their symptoms are actually the result of estrogen loss, offered Jill Osborne, founder of the IC Network. Quote, known as genitourinary syndrome of menopause or vulvovaginal atrophy, their symptoms of urinary frequency, urgency, burning, pain, and recurring UTI often begin after a total hysterectomy, the use of medications which suppress estrogen, or simply with aging. Estrogen loss is often the root cause for women whose urinary symptoms begin as they age. One study of 2,000 women in Britain found that 50% of women between the ages of 55 and 85 experience urogenital symptoms, some quite seriously. 50%, guys. And an estimated 20% of women between the ages of 40 and 45 also struggled with urinary symptoms. Quote, as estrogen levels decline, changes occur in the urethra, bladder, vaginal vestibule, and labia, resulting in a dramatic reduction in skin health and quality. This, in turn, makes skin more vulnerable to chemical irritation and infection, offered Miss Osborne. Young women using birth control might also find themselves urinating more frequently due to the suppression of estrogen. One 18-year-old developed urinary symptoms 2 weeks after starting birth control pills that resolved once she stopped using them. Quote, in 2023, our goal is to help IC patients differentiate between cause and effect. Rather than chasing the symptoms with medications, we want to identify the underlying cause so that the most effective treatments can be utilized, quote, offered Miss Osborne. She continued, for the GSM patient, the primary focus should be on improving the quality and health of the skin, usually with topical estrogen cream. Sadly, some patients don't consider using estrogen therapy because of misinformation about the safety of estrogen use, and some patients prematurely stop using estrogen when their urinary symptoms don't immediately improve. Estrogen therapy takes time. Physicians are now utilizing phenotyping to provide a more individualized diagnostic workup. For example, pelvic floor dysfunction is found in an estimated 85% of men and women struggling with IC. The American Urology Association guidelines for IC suggest that any patient with tight muscles be referred immediately to physical therapy. September 1st launches the annual IC Awareness Month campaign. We want patients and providers to step back and reconsider the diagnosis of IC or overactive bladder in patients not responding to treatment with GSM, pelvic floor, or any other condition missed that could be treated. There you go. That's our official press release for IC Awareness 2023. And my goal here is to, I'm just horrified that so many men and women are told they have an incurable disease when it's not a disease at all. Genitourinary syndrome of menopause is not a disease. It's estrogen atrophy. Pelvic floor dysfunction is not a disease. It's injury. And the thing is what have we learned in the last 100 years? Bladder therapies don't work for the vast majority of us. And many of you have been on bladder therapies 5, 10, 15, 20 years, but you still flare. Why are you still flaring? Because the bladder therapy is what I call chasing the symptoms. It's not fixing the underlying problem. And you have to be laser focused on trying to find out what the underlying problem is. And that's why when you call me or we do coaching, I don't want to hear about treatments, what treatments you've done yet. That's not helpful at all. My job is to try to understand your body a little bit more. So I'm going to always ask a lot of questions about what are your symptoms? How old are you? How old were you when your symptoms began? Was there any event that you associate with the onset of your symptoms, et cetera, et cetera? And so, and then once we have a better idea of subtype, that's when we're going to start talking about treatments a little bit more. And that's when we can usually explain why, hey, that DMSO didn't work for you. You know why? Because, hello, you got estrogen atrophy or you got pelvic floor dysfunction. Now, I was working with one patient yesterday who had really severe pudendal nerve entrapment. I mean, every time she sat down, she was in agony. Got better when she stood up. And her pain was always located in one specific location on the left side. And I said to her, I said, that's not your bladder. You know that, right? She's like, what? And I went, no. The bladder does not cause positional symptoms. The pelvic floor causes positional symptoms. And so if you're struggling with pain that changes as your body moves into different positions, that's really very, very interesting because now we have to look at nerves and we have to look at muscle, right? Now, I got to tell you, now, so y'all know that I'm a widespread pain patient. I was, but my IC is under control. My IBS, I can't even remember my last IBS attack. Been years. My vulvodynia, pretty much fine unless my muscles get tweaked. What do I still struggle with? I struggle with a lot of nerve sensitivity. Although I have to say I forgot to take my B12 for a couple of months. And B12 is really, it's very common for postmenopausal women to be deficient in B12. I picked up my B12 and a lot of my nerve sensitivity has just kind of calmed down, which is good. But the whole TMJ thing, and Jennifer, the answer is yes. Jennifer is saying, is Premarin an estrogen? Yes, it is. It's a brand name. Okay. Are you not sick of going from crisis to crisis? Oh my God. I think that our lives in the last 4 to 5 years have been so traumatizing. From fires to hurricanes to COVID to politics, which I'm sorry is very, very upsetting and traumatizing at times. Seriously, I just want to live. Can we please just have a quiet year? And of course, that's not going to be next year because darn it, that's an election year and the blanket's going to hit the fan during the election year. But I am so incredibly frustrated that it doesn't feel like we have peace in our lives. It's just like, what the heck is going to happen next? And that puts a big burden on us because we have to find that peace. And that means we got to get off the internet, stop reading the paper, and just find that peace, which is why I walked 2.5 miles around the lake this morning to try to do that. Anyway, getting back to TMJ, when you're under high levels of stress, what do? You clench, right? You clench. Some of us clench, some of us open. And my TMJ got really bad. I was rear-ended in my 20s and I dislocated my jaw the next morning from all the neck trauma, the muscle trauma, because TMJ is really a neuromuscular disorder, just like IC. So I bad whiplash and the muscles got super tight and basically dislocated my jaw. And I did smoothies for about 6 months. And then everything went well until, dang it, COVID. 6 months into COVID, bam, TMJ's back like a beast. I have been sleeping in a recliner for almost 3 years. My bedroom was my sanctuary. It's not my sanctuary right now. Right now, the old recliner in my family room is my sanctuary where I sleep. So anyway, after 3 years of waiting, I got to go see a TMJ specialist this last week. And it was a fantastic appointment. Like literally one of the best appointments in my life. And she was up on everything. She understood widespread pain. She understood central sensitization. A lot of her patients struggle with IC, IBS, all that sort of stuff. Oh my God, it was so nice to talk to a peer. Man, we were just sharing stuff back and forth, back and forth, back and forth, because what she knew about it and what I knew about it, we just had this incredible, incredible conversation. But eventually we had to figure out what the hell's going on with Jill Osborne's jaw. And I have ligament laxity. I have a loose ligament on my left side, probably from that original injury. And so that allows my jaw to kind of hang a little bit on this side. And if I lean back, it just kind of falls out of place. So she gave me a lot of really good stuff. And it was so affirming. I told her, I said, one of the things that I do with patients when I work with them on the phone is I always want to give you comfort at the end that there's nothing about your case that alarms me or scares me. You're not peeing blood. There's no sign of a severe disease process happening. That what we've got is kind of a neuromuscular disorder. And so I try to be very conscientious with the patients that I work with and make sure that I give comforting, calming words that are very true. Anyway, she did the same thing to me. It was fantastic. I was like, oh my God, like somebody's actually comforting me. And she's like, Jill, I got to tell you right now, I'm not worried about your jaw at all. I do not believe your jaw is going to dislocate. The x-rays look great. You're healing really, really well. And I want you to walk out of this appointment knowing that I am not worried for you at all. And I was just like, God, oh my God. I just drove home glowing. I was just like, oh, because I had to drive down into the Bay Area, which I didn't really want to do. And it was just wonderful. So anyway, I hope that you get that same feeling when you talk to me. All right, let's go back to your questions here. So you guys remember I'm live streaming on Facebook and YouTube. And so YouTube is on this computer over here. Let me see if I can slide it into place a little bit. Ava said, I had my first installation, don't know anything about the success of these. I feel like I have severe urethral pain, which makes the insertion of a catheter extremely painful. All right, Ava, so with urethral pain, we always want to try to understand what's going on with the urethra. And there are two really dominant things we look for with urethral pain. Number one, estrogen atrophy. The urethra is a canary in the coal mine when it comes to the loss of estrogen. Your urethra, your bladder, your vulva, your vagina need estrogen to produce mucus. When you don't have the estrogen, things start to dry out. And a dry urethra hurts like a beast. A dry urethra will feel like there's a drop of urine stuck in your urethra that won't come out. And so concept number one is, how old are you? And are we dealing with estrogen atrophy? And then concept number two is, can you release urine right away or do you hesitate? If you cannot release urine right away, you hesitate 5, 10, 15, 20 seconds before you can relax enough to release urine, then we know that we're dealing with tight muscles. Now, there are a few other things that can cause urethral pain, but those are going to be the dominant ones. So, Ava, just what I want to know about you is, how old are you? Emma says, a doctor examined my bladder and kidneys, said they all look fine, but a few minutes later, I was told I have IC. I've taken so many antibiotics before. And Jody says, Jill, I'm so happy I found your videos. I had a scope of my bladder and the doctor said my bladder looks fine. Can you still have IC if your bladder looks fine? Yes, because IC doesn't mean anything, hon. Interstitial cystitis is a grab bag diagnosis. It's really a pain syndrome. It's pelvic pain syndrome or bladder pain syndrome. And the fact that you have a completely healthy bladder, well, it's great news. It's great news. But it also means that your pain really isn't coming from your bladder. Your pain is coming from something next to your bladder or beyond your bladder. So anytime you have a hydrodistension or a cystoscopy and they say you've got a good looking bladder, let's celebrate that for what it is. That's really good news. But now what we have to do is we got to figure out what else could be victimizing the bladder and causing these symptoms, like tight pelvic floor muscles, estrogen atrophy, pelvic congestion syndrome, things like that. So it's great news that you got a healthy bladder, but that doesn't mean you don't have pain. It means that something else is probably triggering your pain. So my question to you is, have you had a pelvic floor assessment? Okay, and Ava, here we go. Ava girl. Ava, postmenopausal, just 3 years. So given the fact that you're 3 years postmenopausal, we're always going to be looking at estrogen atrophy in that urethra. Are you using any topical estrogen? Because honestly, a bladder installation is pointless. A bladder installation is what I call chasing your symptoms. A bladder installation will not fix anything. It might make you feel a little bit better because it numbs your bladder wall, and your urethra, but we want to fix it. And if your symptoms are being driven because of estrogen atrophy, we can fix that with estrogen, and your symptoms should go away in just 2 or 3 weeks. That's what happened to me when I was 52. You know, guys, listen, my IC self-help skills are really good. I know my stuff. And when I was like 51, 52 years old, I got this weird urethral irritation. I threw everything I knew at it. Nothing worked. And finally, 3 months in, I threw myself on the mercy of my urologist and I said, please help me. I do not understand what is hurting my urethra so much. And he took one look at me and he goes, Jill. And I'm like, and I remember, now picture this. I'm laying on my back. I'm in the stirrups. He's in between my legs. I'm looking at him through my raised knees. He goes, Jill. And I'm like, what'd I do? And he goes, didn't you use the estrogen cream I prescribed for you last year? And I went, no. And he goes, why? And I said, because in my brain, I'm 25 years old and I can't possibly have an age-related issue. God's honest truth. Come on, I'm 10 years older now and I still feel 25. It's a weird thing about getting older. And he explained to me that the urethra is kind of the canary in the coal mine when it comes to estrogen atrophy. And he gave me a new prescription for estrogen. And within 2 weeks, it was gone. And ironically, if I don't use my estrogen for 2 or 3 weeks, it starts to come back, which is why I'm very invested in keeping my urethra healthy and wet rather than dry. So I hope that helps a little bit. All right, hold on one sec. Let me just take a quick look, see if I missed anything over here. All right, let's go to Facebook here. Let's see. Now, you guys here on Facebook, just please know that it scrolls by so quickly, I could easily miss your question. Don't take it personally if I miss your question, okay? It just is what it is. Trying to fix my computer here. All right. Angie said, it's so hard to find doctors who will look at everything as a whole. Insurance doesn't cover the whole body wellness stuff. My physical therapist recommends a rheumatologist because they will be the most thorough. I'm lost on which doctor to see. I'm only seeing an orthopedic doctor at a moment. Well, Angie, divide and conquer is the right strategy. For your gynecological issues and to deal with estrogen atrophy or anything like that, you go to your gynecologist. If we're dealing with muscle issue, you're going to go to your physical therapist and or an orthopedic surgeon. If you've got any other autoimmune disease like lupus or Sjogren's or anything like that, then yeah, you might be working with a rheumatologist. But there are really very few doctors who can actually do it all, nor do you want them to. Listen, they can't possibly have the experience or specialized training. You know, I mean, that's kind of like asking somebody to be a professional basketball player, football player, and baseball player all at the same time. They're not dedicated to one field. And you really want somebody who has a lot of experience and is fairly dedicated. And so if acidic stuff is no bother, can you still have it? Does it let you pee more at night? Okay. So the people who are food sensitive are people who are either in estrogen atrophy, have Hunner's lesions, chemotherapy, or their muscles are so tight they're in a state of ischemia. If you don't react to acidic foods, that's great. That means your bladder wall's pretty healthy, but that doesn't mean that you don't have tight muscles. It just means that there's something else going on. And that's kind of a bellwether test that would prove to you that if you can, like after I got COVID a couple months ago, I was drinking massive amounts of lemonade. I didn't flare one. I hadn't touched lemonade in 30 years. 30 years. But I was so desperate with COVID, with the coughing. It's like, I need hot lemonade and honey. I was shocked that I had no flare at all from it. None. So what does that mean? It means my bladder wall's healed, and that's what they found in my hydrodistension a couple years ago. Perfectly normal bladder wall. And my muscles are healthy now. I'm not in a state of ischemia, so my bladder's getting good oxygen, good blood supply, and it's staying strong and healthy. Hello, Caroline in England. Hey, I guess you guys had a pretty wicked storm yesterday. And so, let's see, hold on. And said, so if acidic stuff is no bother, can you still have it? Okay. Does it let you pee more at night? You know, nighttime urination is tricky. You know, if you're running to the bathroom because of pain, like you've got to pee because it hurts, then that you fit into the bladder pain syndrome area. If you're running to the bathroom because you feel like you're going to leak, you're in the overactive bladder group rather than the bladder pain group. But sometimes, you know, the number one cause of really severe nighttime urination in the typical estrogen atrophy patient is screwing up your diet and eating something or drinking something you shouldn't have drunk that night. It's usually a testimony to something that's happening during the day. Like, for example, do you take a multivitamin like a Centrum or a One a day? The acid levels of those every single day could cause a lot of irritation that would potentially keep you up at night. But there are other things that can cause nighttime urination, such as diabetes or even heart failure. And so hopefully, you know, like my dad, who was in and out of heart failure for years, he had some nights where he was up several times a night, and then he had other nights where he slept all night long. So this is why it's important that we work with our doctors so we try to understand what's going on so that they can rule out some of that other stuff. And let me just say this, it's worth me saying every single time. Some of you have an attitude of, I'm not going to let IC rob me of something that I love. By golly, I'm going to have that cup of coffee every day. I'm going to have my soda every day. Don't tell me I can't. I'm going to do it. I was working with a patient who was like a couple weeks ago, I'm going to have my Coke every day. I don't care. I'm going to have my Coke, period. And when you think of this as a disease, that makes sense. I'm not going to let this disease rob me of something that I enjoy. Damn it, I'm going to have the Coke anyway. But remember, our guidelines pretty much say this is not a disease. This is a neuromuscular disorder, injury. So if you had an injury on your hand, would you pour acid on it every day? If you had an open bloody wound on your hand, would you pour acid on it? Would you pour a Coke on it every day? No. And what would happen to that wound if you poured acid on it every day? Well, number one, it wouldn't heal. Number two, it would get bigger. And so when you think about this as an injury to the bladder wall, it helps you make better decisions about your food intake. Because literally 1 cup of coffee every 2 weeks will prevent the bladder wall from healing. 1 soda every 2 weeks will prevent the bladder wall from healing. And so realistically, what we normally tell patients to do is we need you to be really good for 3 months. Lose the coffee, lose the soda, lose the irritants for 3 months. Let's just give your bladder wall an opportunity to heal, preferably 6 months. And then once your bladder wall is healed, then what we can do is introduce something similar, like a low acid coffee, Dandy Blend, which is a great herbal coffee, or a root beer, something like that, or, you know, an Italian soda, something like that. But you have to give your bladder a chance to heal first. That skin will not heal as long as you're pouring strong acid on it. She says here, a pipe broken or a wall in her kitchen is out of commission. I'm feeling so overwhelmed trying to figure out what I need to do with insurance, when to pick out what I'm going to eat without a kitchen. It's put me in such a flare. I was saying things about a castor oil poultice you can use on your stomach. Yeah, that castor oil poultices are old school, but they work for some patients. Is there any science behind that? It's been popping up a lot lately on my Facebook stream. Yeah, the book that talked about that, let me see if I still have it. It's an old book. Hold on. Oh, here it is. So, this book called I See Naturally, which you can still get online, was written by a Diana Brady, who, like me, she was earlier into the IC movement than I was because I didn't get started until the early 90s. She was involved in the mid 1980s, and she was a support group leader like me, and her group left like I did, left the ICA, and she started doing her own thing. And she really believed in trying alternatives, and she really was ahead of her time. She has since passed away, and her husband has been selling this book. And I'm pretty sure that she was the one who talked about castor oil. Let me see if I can find it. It doesn't really have a good index. Here, hold on. Let me see if I can find this real quick. I am not against natural approaches at all. I'm all for going a natural approach, but you can't really go into a natural approach until we understand the underlying problem. So for example, a perfectly natural and healthy approach for pelvic floor tension is pelvic floor physical therapy. So this book was written 20 years ago, well before we understood that there were subtypes. I swear it's in here somewhere. Well, it's basically a glorified heating pad. And, I don't see any issues with it. I mean, if you can handle the smell of castor oil. Well, it's in here somewhere. I think, again, I see naturally. Do I recommend that you get this? Only it's very, very outdated now. We've learned a lot about IC since Diana wrote this. But it's actually a pretty good reference guide for some of the more natural approaches. But it's has a good section on diet, good section on pain management, good section on how to calm nerves down. She was ahead of her time. She was a force. I was shocked when I don't remember how she died, but I was shocked that we lost her because she had a very, very important voice. Jody said, I've been in pelvic floor therapy for over a year. I was symptom-free for almost 9 months. Now the bladder pressure urges back. I've been taking vaginal estrogen for 2 months now. You're 51. So again, genitourinary syndrome of menopause. Some patients are really shocked. Let's say you got your first IC in your 30s. And let's just say you're pelvic floor driven. And so, you had a couple of children. The IC symptoms started, clearly linked to an issue with muscles related to childbirth, some sort of injury during childbirth. And then, it takes a year or two, you get things to calm down, things are cool, you're back to eating a fairly normal diet. And then bam, you hit your late 40s, early 50s, and it's back. And emotionally, that's very, very traumatic. It's like, no, no, I thought I was done with this. Well, that onset of symptoms is almost always related to just skin quality, just estrogen atrophy. And so you're doing the right thing. You're taking the estrogen. It's been 2 months. Let's see what would happen. Also understanding that other things change with aging. The pH in your vagina gets a little bit more acidic. It starts to favor more bacteria. So you could get bacterial vaginosis. That potentially could be causing some of these symptoms as well. And again, you have to accept the fact, you and I, we all have to accept the fact that our skin is not as strong and healthy as it used to be. Even if you're taking estrogen, you're never going to have 20-year-old skin anymore. It literally is 60-year-old skin, 50-year-old skin that's been boosted a little bit with estrogen. And it's a bit of a reckoning when it comes to diet and bad habits. Again, if you were that massive coffee or green tea drinker in your 40s, all of a sudden you can't do it because your skin just can't protect itself. And so learning your bladder's happy place with food can be challenging. But making sure you're continuing to use that estrogen is important. And yet here Betsy says estrogen makes her itchy. It's like a yeast infection. So, Betsy, I bet you're having a reaction to something in the cream. So, as an example, Premarin, which is a very popular brand name, is pretty notorious for causing a lot of irritation and discomfort because it has more preservatives in it and alcohol in it to prolong its shelf life. And also, Premarin's a hell expensive. So a lot of patients cannot tolerate Premarin. And I know for me, when my whole urethral episode happened, my gynecologist and my urologist was like, listen, we already know you're super sensitive. We're not going to do a brand name. We're sending it to a compounding pharmacy. You're going to use a preservative-free formula because we know you're already too sensitive. And that turned out to be a tremendous blessing for me. So it doesn't surprise me that your estrogen is making you itchy. It's probably something in the estrogen cream itself that's irritating the heck out of you. Also know that whenever you start estrogen for the first time, especially if you didn't do it in your 50s and now you're in your 60s and your 70s and like, okay, you've got to do the estrogen now, it's going to burn. It's going to burn for about 2 weeks. You got to ride through the burn. And a lot of women, they do it once and they're like, I'm not doing that. That made me burn. The burning means that your skin is very, very dry. It's a tell. And the burning will decrease every time you use it because you're now giving that skin estrogen. You're nourishing that skin. That skin is now replenishing that mucosal layer, and that's going to feel better. So keep using your estrogen. Don't stop it early. But Betsy, in your case, you might need to work with a compounding pharmacy to try to find a formula that doesn't tweak your skin so much. Okay. Sue says, I hope you're not getting all that rain. It's cloudy here. The outer rings of the hurricane are here. The high winds are probably hitting Los Angeles now. And I'm north of San Francisco. And let me tell you, again, I'm so sick of all this, catastrophe after catastrophe. You should see all the newspapers and the TV stations here. It's like the sky is falling, and it's going to cause a lot of flooding. But we're going to make it through where everybody's going to be okay, we hope, unless they try to drive in the middle of a flash flood. Let's just hope everybody stays home and stays safe. I hope so. Sue says, I ignored my doctor's advice about using estradiol cream for 2 years, not thinking it would make a difference with a burning urethra. I don't know why I did. I was worried about cancer, I guess. But it makes a huge difference. And I only use a pea-sized amount once a day in my urethra, and with your urethra and in your vagina. Exactly, Sue. Excellent. That's what I do. You know, the New York Times did a fabulous article on this fear mongering about estrogen. And what's absolutely amazing is like 10 years ago, 15 years ago, somebody wrote an opinion piece saying that all estrogen was bad and would cause cancer. And it was a gross misinterpretation of the data, gross misinterpretation. You know, they were like, 30%. I'm not saying this is exact the number, but to give you an idea of how badly they misinterpreted the data in the study, their conclusion was that a great majority of women would be at risk for active cancer, when actually what the research showed, it was like 0.003%. But the person misinterpreted the statistics and created this massive fear about estrogen. Now, oral estrogen is more risky because you're swallowing it. It is going to be absorbed into your bloodstream. It is going to be spread throughout your body. So oral estrogen over the age of 60 does carry a risk of cancer. Topical estrogen does not. Topical estrogen tends to stay in the skin and is considered very safe. And all the recent research studies have confirmed that, even for patients with active estrogen-driven cancers. But ultimately, in the end, this is about you reading about it, looking at the research, and having a good, honest discussion about your fears with your doctor. You can't, you know, it's not my job to give you medical advice. It's my job to give you context. But ultimately, in the end, if you have any fears at all, you got to talk with your doctor about it and have a good discussion about it. I personally, now you guys, y'all know, for those of you who followed me, I went through uterine cancer, a massive uterine cancer scare, an emergency hysterectomy in 2017. I had been taking oral estrogen for 5 years because my mother took it. We have no history of any estrogen-driven cancers on both sides of my family. Not a single case of breast cancer, uterine cancer, cervical cancer, nothing. I was really struggling with a lot of muscle spasming because of menopause. And I thought, you know what? My mom's used it for 40 years. For God's sake, she lived till she was 94. If she could do it, certainly I should be able to do it. And I loved how I felt on oral estrogen. My skin plumped up, my thinking was clear, my muscles calmed down. And then I started spotting. And it was like a very pale pink lemonade. I noticed that for a couple of weeks, emailed my doctor, said, hey, you know, I got this weird little pink thing going on. And he's like, you know, Jill, you should come in. Maybe you should come in. We should probably do a biopsy. And I'm like, oh, I don't really want to do that, hysteroscopy. And he's like, well, you know, you're on estrogen. It's probably fine, right? And I let my fear stop me. You know, I made a really huge mistake. I let my fear stop me. And then that was like in September. Well, by December, no, was it December or November? I was passing bright red blood and blood clots, big blood clots. So it had progressed from this very, very pale pink to huge blood clots. Call my doctor again. Doc, it's gotten a lot worse. He goes, Jill, you should come in. We need to look in your to look in your uterus. And I'm like, oh, I don't really want to do that. He's like, well, let's just give you some Premarin. Let's just some progesterone. Let's just force a period. I'm an idiot. I had heard such terrible stories about hysteroscopy. And that's where they pry open your cervix and stick something in to grab a piece of a uterus to do a biopsy. Horrible stories. Not a family member who was bawling her eyes out afterwards. I didn't want to have it done. And so then we took progesterone for 3 months, didn't force a period, go back in. It's like, all right, we're looking now. We did a hysteroscopy. We did a DNC. They both found atypical cells that can turn into cancer cells. And I had the emergency hysterectomy. My formal diagnosis was complex endometrial hyperplasia with atypia and a vague architectural complex, which meant it was starting to build a tumor. So we got it all out in the nick of time. So don't learn from my mistake. Don't let fear stop you. Alexandra said, well, I will do Botox next month. Is it okay? Is it good? Well, Alexandra, Botox, we have a whole section on Botox on our website. It depends upon where they put it. You have to be prepared for the fact that if they accidentally numb the nerves in your bladder, you might have to self-catheterize for several weeks. Alexandra, hold on. So Sue told Alexandra she gets Botox for tight pelvic floor muscles. And she had a doctor do it that wasn't experienced the first time, but when I went to see Dr. Peters, a national specialist, it was much more effective. Sue says, I sent 2 ladies your way when I went to Dr. Peters' office this week. They were running behind and we were all chatting in the office. I'm still shocked at how little people still know, even though they're seeing a good doctor. Thank you, Sue. Thank you for referring them to our website. Hi, Kayleen. Girl, how you doing, Kayleen? Sue says, homeopathic people say it can penetrate up to 6 inches if you use with heat. When you put a castor oil on a cotton cloth, you can save up for a month in the refrigerator. Never heard of this. Didn't know if I want to spend the money. If it was, I don't know anybody who does castor oil packs. It was discussed randomly every now and then. It's certainly not a cure in any way, shape, or form. You're welcome, Betsy and Jody. You're very, very welcome. Always happy to try to help. Hi, Boria. How are you today? How are you today? So what do we have going? Okay. So while you guys remember, I will continue as long as you have questions for me. So keep asking those questions. On September 1st, IC Awareness Month starts. So what is IC Awareness Month? This is an opportunity where you get to get involved. I want you to critically think and look at your community and your doctors. Are they treating you well? Do they know about IC? Are they giving you hope? If they're not, then what I hope you'll do is go on over to icawareness.org, icawareness.org, and you can download our press release, which I haven't uploaded yet, but it will be uploaded tomorrow, and send it to your local paper. And let's see if we can raise some awareness about IC in your community. IC Awareness Month isn't about me. It's not about the IC network. It's not about ICA. It's about you. Elke said, there's no cure for my many types of IC. You've tried all except InterStim and Botox. And now you have uterine cancer. Oh, honey, I'm so sorry. She says this country needs assisted death. Elke, you are obviously in great distress. And I would love to talk to you if you would like to have a conversation this week, because I would really like to see if we can identify some things that you might have missed. So, for example, do you feel a heaviness in your pelvis? Do you feel like you're carrying a bowling ball around in your pelvis? We know what that is. It's pelvic congestion syndrome. And what our national guidelines say is if you're not responding to therapy, if you're getting worse rather than better, let's take a step back and revisit the diagnosis and ask ourselves, what did we miss in Elke? What did we miss in Elke? And depending upon your phenotype, we want to make sure that you've exhausted all the treatments in your unique group. So I would want to know, number one, have you had a pelvic floor assessment? And if your muscles are tight, have you done physical therapy? Because the single most effective treatment out there that helps a great majority of patients is pelvic floor physical therapy. If you're in massive amounts of bladder pain, Um, um, the number one cause of long-term chronic bladder pain is untreated Hunner's lesion. So you're having an EUS endo tomorrow. It feels like pancreatic. You did physical therapy, nothing. Okay, I understand that you did physical therapy, but what did the physical therapist find? That's the most important question. When you went to physical therapy the first time and you had your evaluation, what did they find? Were your muscles tight? Were they tight on the left? Were they tight on the right? Because there is a group of patients whose muscles stay tight. They found scar tissue. Okay. What was that scar tissue from? Danielle says, for some reason, I've been commenting for the past half hour since the newspapers, and apparently you're not seeing anything putting up on Facebook at all. So I jumped onto YouTube. Thank you, Danielle. Yeah, no, I was a little bit behind on Facebook. No, sure. Hi, Mina. Virginia said, I've been suffering with IC since February. Severe pain, frequency, incontinence, and pelvic pain. Okay, so Virginia, how old are you? How old are you? That's the first question. And is there any event that you associate with the onset of your symptoms? What happened in February? Did you get COVID? Did you fall? Did you have a baby? What happened in February? And you know, Elke, as somebody who went through the whole cancer thing, you know, I was thinking about this actually. I was thinking about this yesterday for some reason. I was at my I was at my dermatologist's office not long ago, and there was this lady absolutely sobbing, just sobbing in the entrance. She's kind of over in a corner, and she's just absolutely sobbing. And I'm like, looking at the reception, I'm looking at her, I'm looking at the reception going, hey, what are you gonna help her? They're like, no. I go over her. I went over and I sat next to her. I've done that several times. It's just like, listen, this is somebody in deep distress. I'm just going to be with her. And I just said, hon, I don't know what's going on, but I just want you to know you're not alone and I'm right here. I just wanted to be a force of strength for her. And she kind of slowly calmed down. And then she said that she'd just been diagnosed with cancer. And, you know, that cancer word is just so devastating because it's like you've been blindfolded and thrown into a car and you have no idea where you're going and you have no idea who's driving and you know you're not driving. Now it's like you're in rough water. It's just being tossed to the left, to the right, to the left, to the right. And it's such a difficult moment. And you have to surround yourself with people that you love, and you've got to be aggressive and assertive with your care. You can't be passive. You got to be really active and really push back and walk into that doctor's office having read about the research and the types of surgeries and all that sort of stuff so that you can have a good discussion. You know, as soon as they said, Jill, we don't know if there's active cancer in your uterus right now or not. What we know is that you have the precancer and it's starting to build something. So it is our recommendation you have a hysterectomy immediately. My number one fear was, will it hurt my IC? And this is the only time I've ever talked to my medical board. We have an informal medical board of really the top doctors in the world. And for the first time, I told them my story and I asked them for feedback for me. And they all said, Jill, we got to save your life. So you're going to have the hysterectomy. But they gave me very clear tips and it did not hurt my bladder at all. And I'm really grateful. So if I can give you a little bit of extra support and comfort doing that, I would be happy to do that. And getting back to your question, the state of Oregon does. Virginia said, I've been treated for overactive bladder for 2.5 years. Then the Gentessa stopped working. So if you've got pain, you're not an overactive bladder patient. You're a interstitial cystitis bladder pain patient. Overactive bladder does not cause pain. Overactive bladder causes frequency, urgency. It does not cause pain. So, again, Virginia, how old are you? That's important. We have to know how old you are because that's going to help us understand the health of your bladder wall, and that could help us understand why you're in such severe flares. Kristen said, I get severe pain in my bladder after my C-section, and castor oil packs, Queen of Thrones, is helping my pain amazingly as it is proven to shrink cancer tumors, ovarian cysts, and everything and anything. Look it up on YouTube or Facebook or on TikTok. Yeah, hon, I know about castor oil. We knew about this 20 years ago. It's just not commonly used. But I'm really glad that it's helping you. There's no harm in it as far as I know. And again, I think it was Diana Brady who 20 years ago was the first to talk about castor oil packs. I swear it's in here. Oh, here it is. Hey, found it. Look at that. Opened it, found it. This is in her section, Treatment for IC Pain, page 115. So here's her suggestion. She's got lots of suggestions. Apply a castor oil pack to your bladder without heat. Heat can cause an infection. Organic castor oil can be purchased at Heritage Products. Sterile pads can be found on Amazon. Spread pure organic castor oil lightly on a sterile, wet-proof 8x10-inch abdominal pad. Place a pad over your bladder. Cover the pad with a paper towel and leave in place for several hours. Castor oil is very soothing. You can also put a castor oil pack on your lower back with or without heat. A word of caution, however, take care not to get any on your clothes as it does stain and is almost impossible to remove. I'm glad it works. Good. I mean, keep it up. But just, there are lots of other things that you can also do too. Danielle, I don't know why we couldn't see your stuff. I just don't know why. I can see your comments on YouTube. Let me scroll back on Facebook. Hold on. I see nothing from you in the Facebook feed, hon. Nothing. Maybe you've been throttled by Facebook for some reason or another. Ava says, can I ask you, do you think installations work? I'm hesitant on continuing installations. Ava, it depends upon your subtype. So you, in all likelihood, are going to be an estrogen atrophy patient because if I remember correctly, your symptoms, you're 63, right? Yeah, you're 63. So we have to think about what we're trying to accomplish here. So think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste because urine is body waste. So urine contains ammonia and urea and all sorts of irritants. So how can the bladder hold ammonia for hours at a time and not get damaged? Well, it's wet on the inside. It's got a really thick coating of mucus. Your bladder's like your mouth. It's a hollow organ covered with a wet coating of mucus. And that mucus is a barrier. It protects the skin. It makes it difficult to get an infection because bacteria have to burrow through the mucus. It makes it difficult. It keeps the irritants in your urine away from the more sensitive nerves in your bladder wall. So this mucus is everything. Think about how painful dry mouth is. Dry mouth hurts. Well, listen, dry bladder hurts. Unfortunately, that mucus is estrogen dependent. So when you're young, you have a lot of estrogen, you got a lot of mucus, you get away with stuff. But at the age of 63 or 53, You don't have the estrogen anymore. Therefore, you don't have as much mucus anymore. Therefore, your bladder's ability to defend itself is now compromised. There's no disease. You're dry. That's called the genitourinary syndrome of menopause. So therapeutically, what do we want to do? Well, the first thing we want to do is get the skin better. If we can give that skin some estrogen, that skin will immediately start to produce mucus. That's the most natural thing you could possibly do, is just improve the health of the skin. And you can see, think about a raisin and what happens when you put a raisin in water, it plumps up. Well, that's what dry skin cells do when you give estrogen. It plumps up. It becomes much more healthy and much more productive. So our therapeutic priority, number one, is to improve the skin health. That's usually with estrogen. The bladder instillation might be soothing to your bladder, but it's not going to repair anything. So if you're doing a heparin lidocaine instillation, which we call a rescue instillation, the heparin is coating your bladder wall, giving your bladder a little bit more oomph, and the lidocaine is turning the nerves off. And so it's called a rescue for a reason. It rescues you out of a flare, but you have to keep doing it. I call that chasing the symptoms. So all the bladder instillations chase the symptoms. They don't fix anything. They just calm nerves down, et cetera, et cetera. The concept of a coating is important because your bladder is an older bladder now. And so you might actually benefit from, if you're in Europe, an hyaluronate bladder instillation, which is a combination of chondroitin and hyaluronate. We don't have this in the US. It is available in Canada and Europe. Chondroitin is a critical building block of the bladder wall. Chondroitin is essential to the superficial integrity of the bladder wall. So the most important ingredient for a bladder instill really is going to be chondroitin. So instead of doing the chondroitin instills, which we don't have, a lot of patients instead do chondroitin supplements. That's going to be the bladder builder, the bladder rest, the cystomen. Those are going to be the most popular bladder supplements that will give the bladder a little bit of an extra coating. Now, some patients go to aloe. Aloe is soothing to the skin. If you have a sunburn, aloe has a soothing effect. But it does not have a constructive effect because the bladder is not made of plant material. But aloe, if you're in a flare, might also be helpful. Kayleen says here, and Kayleen, hun, I did see your post on Facebook. I just hadn't gotten to it. Kayleen says here, this was before the flare that Mountain Dew caused, but I keep waking up 1 to 2 times overnight to pee. That's not bad. I'm not sure if this hernia is putting pressure on anything. I can't laugh or run without a pulling pain. I've heard that for some people, bladder installations stop working. I'm hoping and praying that's not my case. My next one is Friday. Well, again, Kayleen, your case is complex, and you're basically kind of, you're doing whack-a-mole right now. You're doing whack a symptom and whack a treatment right now. So, Kayleen, we know for you, you got a Wampin hernia. We know that you've got very, very tight pelvic floor muscles. We know that you have spinal injury, compressed nerves in your back, right? So you have, whack-a-mole is as annoying as that is. That's a good concept of whack-a-mole because you got to keep these separate in your brain. And just understand, you've got to do things for your pelvic floor, like your physical therapy. You've got to do things for the hernia. Hopefully they can fix that. And you've got to do things to protect your spinal cord and all that sort of stuff too. But you got this. You're doing so well. Good luck on Friday, hon. Good luck on Friday. So let me look at what you wrote here on YouTube. Hey, you're doing the wand? Excellent. How is that going? Can you feel the tight muscles? I mean, now that you're using your wand, can you feel the healthy muscle versus the tight dysfunctional muscle? Just out of curiosity. Elke had a sigmoid colectomy. Okay. I don't know about the foam. So, Elke, if you were on Elmeron has now been linked to inflammatory bowel disease and colectomy. In fact, I was working with a patient last week who called because they found that she had severe retinal damage from using Elmeron. She'd been on it for over 20 years. And so she was calling to see if I knew of an attorney, and I don't give attorney recommendations. But anyway, I did happen to mention, hey, did you hear about our concern with Elmeron, that it can cause inflammatory bowel disease and it can lead to colectomy? And she goes, oh my God, I just had my bowel removed last year. I had a portion of my colon removed. And I went, yeah, that's probably from the Elmeron. She was gobsmacked. Kayleen said, yes, and it's getting better over time. My tight muscles are on the left and they go up to my hip flexor. It's so fascinating, isn't it? And like, you're probably not afraid of it at all now. Like, whenever I do my internal work, I always look for the painful part because I know that's where I need to work, because I know that's where my tight muscles are. And that I can work those muscles and get them to relax and get them out of pain. Virginia said, 78, what I was having was UTI symptoms since November with no positive test. Okay, so Virginia, you need to Google genitourinary syndrome of menopause. Here, I'm going to type it in the YouTube chat right now. There you go. I misspelled menopause. Menopause. Okay, that's a real thing. And at your age, in your late 70s, hon, you're dry. And that absolutely is going to affect your bladder, because your bladder needs estrogen and you don't have the estrogen anymore. Hopefully, you're using some topical estrogen cream, in your vagina by the entrance to your urethra to try to help that skin. But honey, you're dry. And so for you, in your case, what you've really got to understand is, because you're dry and because your bladder can't defend itself, because it doesn't have that mucus so much anymore, is diet is going to be everything for you. Like right now, you should not be drinking any coffee or tea or soda, or even a multivitamin would be very, very irritating. And so it's very, very important that you have a discussion with your gynecologist or with your primary care provider. Let them know that you're having, I'm sure they already know you're having recurring symptoms, but has anybody talked about estrogen atrophy for you yet? Has anybody mentioned that at all? You're exactly why we've dedicated the 2023 IC Awareness Month to GSM. Sue says, so Sue's talking about homeopathic medicine and the castor oil thing. And she asked, what kind of symptoms did you use it for? She's not asking me. She's asking somebody else in chat. I need to find more homeopathic approaches, since having COVID will work for me before makes my blood pressure too low. I get really bad across the top of my bladder, spasms even with Botox, because I had a stroke when I had COVID and now I'm weak on my left side. Yeah, honey. And you guys, listen, when the kids are back in school, all the colds, all the flus, the COVID's going to go, it's already going up. And so you got to protect yourself as an IC patient, because we know that some IC patients who get COVID get very, very severe flares. That's a cytokine storm of COVID hitting the bladder. So I'm not going to movies. I'm not going to concerts. I'm not getting on planes. I have no interest in getting COVID again now that I've had it once. Danielle, I see that on Facebook. Danielle says, can you see anything I'm typing at all? I have a question for you. Yes, I can see that. It just scrolls back really fast. It scrolls back really quick. So hold on. So I've got to scroll back. So for Danielle, she says, I wanted to ask a question about acupuncture for some reason. I was in the wrong group on the wrong day for over an hour, and I did not realize I was watching one of your last week's episodes. Okay, well, at least I'm not completely crazy, but I'm sitting here having a panic attack. Let me know when I see this, honey. Deep breath. Let's just take a deep breath in and a deep breath out. Deep breath in, deep breath out. One more time. Deep breath in, deep breath out. All right. What's your question on acupuncture? Give me your question, girl. All right. Alexandra says, what exams? So here, hold on. Yvonne says, why can't we get that here? I've heard it works great. Okay. Alexandra says, what exams must I do to check all things in the whole area down there? I've had multiple cystoscopies and a biopsy. A pelvic floor assessment, that's the piece that you're missing. We got to get somebody to look at your anatomy, look at your muscles and nerves and bones down there. That's the big missing piece of this puzzle. Alexandra says, I can feel frequency, urgency, pelvic pain. Sometimes I can't wear clothes. I feel pressure down there. I feel the nerves and the muscles sometimes. So that puts you into IC subtype 3, pelvic floor, IC subtype 4, pudendal neuralgia. If you have positional symptoms, you're fine when you stand, but when you sit down, it hurts. That's pudendal neuralgia. That means you have a muscle that's squeezing your pudendal nerve. Or if you have widespread pain, you've got very sensitive skin, you've got a wicked sense of smell, which is how we started this meeting talking about that. That means that you have a very sensitive nervous system like I do. And our therapies for that are going to be focused on calming nerves down. Ava says here, okay, my symptoms started after childbirth many years ago. You came out of the hospital with a massive UTI due to a tear. Exactly. That's a huge, huge injury. Did you tear into your rectum? Or was your rectum like for some women the episiotomies get too long? Sometimes, I mean, just listen, the greatest gift a woman can give a man is to risk her life to bear his child, because bearing children comes with risks. And as Ava said here, my symptoms started after childbirth because she had a massive tear. And your answer is yes. So it went into your rectum. Oh, honey, I'm so sorry. I'm so, so sorry. So not only did you suffer a tear, you suffered an injury to muscles. And so have you had a pelvic floor assessment? Have you had a pelvic floor assessment? We need a physical therapist to look at that scar tissue, because your scar tissue, may be just bunching up and getting more painful. But scar tissue, if you work with it correctly, you can release some of that scar tissue and release some of that pain. No, you've not had a pelvic floor assessment. Well, girl, that's your next step. Time to have a pelvic floor assessment. Let's try to get an idea of what's going on with your muscles, nerves, and scars down there. Okay, getting back to Danielle here. I was wondering if doing acupuncture in the area between the anus and the vagina would be safe and maybe not hurt the nerve ending so much anymore. Oh, Danielle, it's okay. Not a problem at all. Let me pull out another book. Hold on. Oh, I get so stiff sitting here. Where is it? right here. Okay. So this book, Ending Female Pelvic Pain by Isa Herrera, is a very practical book. Like, it tells you where to put TENS units and things like that. Let me just see where to put, a TENS unit pad. Let me just see if she has a guide in here for acupuncture. She does not. I don't know. I honestly don't know. I don't think I've ever had anybody tell me that they've had an acupuncture needle put on their perineum, because that's your perineum, that piece of skin between your vagina and your rectum. Therapeutically, so acupuncture kind of calms nerves down, right? So the most common acupuncture point that's used for IC symptoms is actually the SP6 acupuncture point, which I had done, and it's right above the ankle. So let me see if I can show you. All right. Okay. I don't know if you can see this little tiny black spot right here. I got a little tiny black spot. See that right there? So the SP6 acupuncture point is 3 finger widths above the ankle bone, and it's about 1 finger length below center. So it's right in this. It's actually moved a little tiny bit, but I was one of the early Staller nerve stimulation patients. And this is where they put the acupuncture needle, right in SP6. And so I've got a little tattoo there, and then on my right leg, let's see, where is it? Oh, it's really faded. It's right there. So again, 3 finger widths above the ankle bone, 1 finger length below center, and it's right there. So this is the targeted acupuncture point for the urgent PC, which is a non-invasive neuromodulation used for IC and bladder pain and pelvic pain. And I was very blessed that when in my first year, 30 years ago, I was referred to UC San Francisco, where it was invented. So they use an acupuncture needle as a vector to the nerve, then they attach a TENS unit to it to provide a very gentle current / stimulation to try to re-regulate that nerve in a little bit better. So they never ever talked about doing any acupuncture work in between your legs. It was always down at the ankle. Now, I will say for me, I once tried whole body acupuncture and I hated it. It was too much stimulation. I didn't like it at all. I didn't like it at all. Ava, if you're looking for a pelvic floor physical therapist, there's a website. If you go to pelvicrehab.com, that is our best database of active physical therapists who are trained in pelvic floor work, because this is not a Kegel exercise. Kegels will only make it worse. But remember, Ava, we have now really learned that the vast majority of IC patients, 85% of IC patients, have a muscle injury. Like me. Remember, My symptoms started in 7th grade. I couldn't sit through class, frequency, urgency. The teachers got pissed off. They called my mother. I went to a urologist. They had me swallow 16 sulfates at that appointment. They thought I had a massive bladder infection, which I didn't. I was diagnosed with a urethral stricture. That meant that my urethra was very, very narrow. It's kind of like trying to pee through a needle. It was hard to pee. Okay, now we know what that means. Hey, if you can't start your urine stream, hello, that usually means that your muscles are super, super tight. And of course, my symptoms began after I broke my tailbone in 7th grade, and my muscles were very, very tight. But of course, back then, back in the 70s, they didn't know that. And so they did bladder stuff. And hon, I did bladder stuff for decades, never got better. What finally healed me was literally less than 10 years ago when I had a proper pelvic floor assessment and they found very, very tight muscles. And I did physical therapy. And whoa, guess what? All of my pain is gone and my related conditions are gone. The IC, the IBS, the vulvodynia, that's all gone with pelvic floor physical therapy. And if I hurt myself again, as I am wont to do, I almost fell walking today. This morning, I caught myself. But if I get in the car for a long period of time, I'm going to have a pelvic floor spasm, no doubt about it. And so you can tweak those muscles again and experience these symptoms again. But now we know exactly what to do about it. We're not going to waste our time. I'm not going to waste my time doing DMSO and bladder installations. I have a perfectly healthy bladder. There's nothing wrong with my bladder. For me, it's always been my muscles. Alexandra says, I want to trust a doctor in a topical hospital, a good doctor that understands how to do Botox. Is there a danger if I do Botox? Botox absolutely comes with risks. If they accidentally silence the nerve that controls your ability to urinate, you have to self-catheterize. Botox is not supposed to be used in anybody who cannot self-catheterize. But you really want to be with a doctor who's very, very experienced. So we have some doctors around the country who are our national experts. So if you tell me what state you're in, I can potentially tell you who the closest national expert is. Sue says, I'm logging out. My mother's making us dinner tonight, hence no kitchen prayers. This remodel goes smoothly. Let's see, quickly and smoothly. I can't eat processed food. I'm hoping my insurance company will pay for some meals. Good luck, honey. Jeannie says, urologist, I put some kind of shots in there, and that did help. I'm sorry, I don't remember what was in the shots. Probably lidocaine. Denise says, love your glasses. Thank you. I got 3 new pairs of glasses just to have fun. This is my happy pair. Danielle said, this is so interesting. I do appreciate this. And I'm sorry to interrupt the group because I was in the wrong one from last week asking questions and wondering why nobody was talking to me. I also have a doctor promise me something and I want to tell you what it is. Sure, tell me. Donna says, sitting in a hospital with my husband that has cancer that has spread. Oh, honey, big giant hug to you. His kidney stopped working. Oh, and you had to call an ambulance. You couldn't lift him up. The stress and not eating, scared to eat. I have an eating disorder. I'm 40 minutes away from home. So I drink all day. My poor bladder, my stress is killing me. Donna, you know, honey, you got to care for yourself too. I have been, as you know, I mean, I just did my hospital duty with my parents. And girl, I understand your stress. I totally understand why you're upset. You're not eating. You're drinking more. I that you're drinking water and whatever else you're doing. It's hard to advocate for yourself when the people around you are suffering. So no shame, no blame. There's no right or wrong right now. It's about eating what appeals to you. And You know, if you want to have a cinnamon roll, eat a cinnamon roll. If you want, you know, hospital food ain't the best, but usually they have a fairly decent turkey sandwich or a ham and cheese sandwich. Go eat a sandwich. And remember that you can't be there for them if you're not well. So you're not eating for you, you're eating for him. Because we want you to be there with him. We want you to be his support and his comfort. And so I know you don't want to eat for yourself, but you need to eat for him so that you can be there for him. And the blessing that you're doing is that you're there. You're there. And it's eating you up inside. It's hard. I know it's hard. I just went through this. But you won't regret it. You won't regret it. You can do this, honey. You're strong. You've never been more prepared to deal with whatever happens to you than you are at this very moment, because you are truly one day older, one day wiser, and one day stronger. And sometimes it's just a minute at a time. If you find that you're really stressing, get up, walk into the hallway, look out a window, do some deep breathing. Get up and walk around once an hour. If you can go outside, go outside. If you can go sit in the chapel, go sit in the chapel. If you want to talk to the chaplain's almost always there. But you're tough, and you're going to do this. You're going to do this for him, and you're doing this for you. And honey, big, 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 big. Oh, biggest hugs to you. Big, big hug to you. Okay? You're not alone, hon. You're not alone. Hello, Diane. Danielle says, I know that you had spoke about subtypes, and since I've not been properly diagnosed with my subtype and I've explained my surgeries to you in the past, basically my aunt has a doctor outside of the box, and he said that putting ozone up my vagina would possibly help my IC symptoms, and the patients are saying they're doing well. I'm afraid I'm hopeless at this point. Or any thoughts? Oh, ozone up the vagina. I got no information for you on that. Let's let me be a little. Whoa, that scared me. Oh, thank you, whoever that was. Somebody gave me stars. You guys, if you find, oh, Jan, thank you so much for the 99 stars. You guys, if you find these meetings helpful, please think about making a donation to the IC Network, going over to our website, icnetwork.org, or becoming a member, or just signing up for our free newsletter. That's what pays for this. Or people who buy stuff in our store, like heating pads and supplements and things like that, or people who become members. And of course, if you do become a member of the IC Network, you get our wonderful magazine, The IC Optimist. And this is the one that we just released last week. Betsy said, do REDs for macular degeneration bother the bladder? Usually they do, because they have a lot of vitamin C in them. So what you could do potentially is you could do pre-leaf with the vitamin to try to reduce the acid level. That's a viable option. You know, it's getting dark. You see how it's getting a little dark in here? Hold on a sec. Hold on. I've got stuff in the window. You can see some of my, isn't that pretty? One of my neighbors did that. And then I bought this watercolor. I mean, I surround myself with happy things from a lady in England. But let me just see if I can improve the lighting here. Hold on. Oh, sometimes when it's cloudy outside, see, this is our other sign. Okay, is that light better? Yeah, I think that's a little bit better. Okay, so now I know I was talking to somebody and then I got distracted. So hold on a sec. Jan, I will answer your question in a moment. Lauren, hold on one sec. So Danielle, I got to get back to the ozone for a second. So some doctors telling her to put ozone in her vagina. Let's just see if we can get a little bit of safety data on this. So hold on one sec. So according to the National Institutes of Health, ozone therapy is a new concept in the clinical treatment of vaginitis. The medical integrated ozone therapeutic apparatus uses an ozone generator to prepare a certain concentration of ozone and mixes it with filtered tap water to form ozonated water. I don't have any data. So hold on a sec. Let me go to the National Library of Medicine. And let's just see ozone therapy bladder. Let's see if there's anything. Oh, okay. Here's an interesting study. Man, it's an old study from Russia. No, let's move on. Okay, it's a rat study. Chemical cystitis developed in experimental animal studies, the topical effect of intravesical ozone application to the bladder. Oh, okay. Here's a study this year. Okay, hold on. All right. So it came out last month. And this is a study from where? Brazil? Brazil. Okay, so this was a prospective clinical preliminary study was performed in patients with IC who were non-responders to conventional treatment and received intravesical ozone as a therapeutic alternative. 16 patients received 6 applications of intravesical ozone at a concentration of 41 micrograms. We evaluated the therapeutic efficacy. The mean age was 52.9 years. The duration of symptoms was 5.7 years. Wow. 92 to 97% effectiveness rating. They conclude the application of intravesical ozone was effective in the treatment of patients with IC who were non-responders to conventional therapy, showing a progressive and safe effect, at least in the short term. And that was published by the International Urogynecology Association. That's brand new. Like literally, that was just published. I mean, I normally read all the new IC studies once a month. I hadn't even seen that. So based upon that, Danielle, interesting. It's early, but it looks pretty encouraging. I think we would. Now that was a study from Brazil. I don't have the time to go through to see if we have U.S. studies, but it's very, very interesting. Nina, what was your question, hon? I see you deleted it. Nina, it's okay. You can ask your question. Lauren said, I started physical therapy 3 weeks ago. She said, I have weak muscles and I'm overusing my secondary muscles, such as my butt and hips. My urogynecologist said I have a tight pelvic floor. My physical therapist has me doing some Kegels to strengthen my pelvic floor, in which my secondary muscles should then work less. What do you think? I feel no better. It actually bothers me to do the Kegel because when I release it, it takes like 15 seconds. There's lots of concentration to release from just one Kegel. What she's having you do is a quick flick. Normally, if you're doing a Kegel for incontinence, you're going to tighten, hold for a couple of seconds, and then release. But a quick flick that's used for patients who have weak muscles is you tighten for a second, and then you focus on the releasing. And so the fact that it takes you 15 seconds to release your muscles really means that your muscles are very tight, and I'm glad you're working on that. And trigger point injections are absolutely viable if you've got trigger points. Okay, but you got to keep up the pelvic floor. And then, Lauren, the question you've got to ask a physical therapist is, are your muscles responding to therapy or are they staying tight? If your muscles are always locking back down into tension, then that means we've got to look at what puts long-term chronic stress on muscles, which is going to be bones. Do you have a bad hip, a bad SI joint? Do you have a broken tailbone? Do you have a bad knee? Or most of all, do you walk correctly? Because a lot of long-term chronic muscle tension actually begins in the feet and how you walk. Jan says, hi from Scotland. Hello, Scotland. Since you have had, I see you feel exhausted, like fibromyalgia or ME, need some kind of diagnosis regarding chronic fatigue, not enough support in Scotland, and find you very uplifting. Thank you. Well, you're very welcome, honey. Any comments regarding interstitial cystitis and chronic fatigue? Well, when we look at our subtypes, right? So we've got the Hunner's lesion subtype, we've got the bladder wall subtype, we got the pelvic floor subtype, we got the pudendal neuralgia subtype, and we've got the widespread pain subtype. And so the fact that you have interstitial cystitis and chronic fatigue suggestive of fibromyalgia or chronic fatigue syndrome kind of puts you into that group where we know that we're dealing with nerves. We're dealing with nerves that have been injured and or inflamed. So Jan, do you have IBS, vulvodynia, super sensitive skin, wicked sense of smell? Do you have any of those things going on? Because that will help us understand if you're in this widespread pain group. And there's really good news here because we know what to do there. Danielle said the doctor in question is the Institute for Complementary and Alternative Medicine. Okay, that sounds good. Carolyn said, just finished the second round of diflucan. Can't get rid of this yeast infection since April of 23. Girl, I don't know if you've seen we've had a lot of recent press about some very, very drug-resistant candidas that are spreading around the world. It's not Candida albicans, it's Candida auris. I think it's AURIS. Remember, I had a drug-resistant Candida infection for 2 years because I took antibiotics back when we were all taking antibiotics for our IC, and it triggered this really wicked infection for me. So remember the theory of Candida. Candida needs sugar and a warm environment. And so for me, what always triggered my Candida was milk or ice cream. Anything with milk sugar. Within 6 hours, my Candida would be screaming, my bladder would be screaming. And let me tell you guys, you got to understand, you can have Candida, you can have fungus in your bladder. We have the proof. We have next generation DNA urine testing from our own National Institutes of Health, who found that some IC patients who were flaring with severe bladder pain had a fungus. They had Candida in their bladder. Okay, so that's real. That's accepted. Our own government's research here in the US found it. And now we kind of know, we know why, because number one, if there's a group of patients massively overexposed to antibiotics, it's lower urinary tract patients, because we all have been given antibiotics often for long periods of time, myself included. That completely disrupts the biome, which allows the Candida to grow. But in the end, okay, so concept number one is we got to balance out the biome. Antibiotics damage the biome. So if every opportunity, if there's a chance to avoid using antibiotics, that's important. So if you routinely take antibiotics for your IC flares, stop it. You only take antibiotics if you have a confirmed bladder infection based upon urine culture results or next generation results. Okay, the bladder only knows one language: frequency, urgency, pressure, pain. You could have a bullet wound and it would feel like an infection. You could have a stab wound and it would feel like infection. Everything feels like infection in the bladder, but don't assume it is, and don't pop antibiotics, because I know you've got that pill bottle of antibiotics in your bedside table just in case. You got to understand that antibiotics damage the biome and create a foundation for fungus in your bladder. The second concept, Carolyn, is you can't feed it. Candida needs sugar. And so there's a book called The Yeast Connection, or another book called The Yeast Connection in Women. That's a book that I used. It was very, very helpful for me. I didn't realize that eating pasta was equivalent to eating Snickers bars in sugar. The amount of sugar in pasta is astronomical. And again, for me personally, it was milk sugars really made that fungus grow. If you read the literature for diflucan, if you read the product information sheet, there's a little sentence in the little tiny, tiny fine print that says some candida infections require long-term treatment. That doing the 1 or 2 pills of candida will not touch it. And that was very true for me. I had to do 3 rounds of 7 days a week. I did diflucan 3 times a day, 7 days a week. I did so much diflucan, they were worried about my liver, but we were desperately trying to kill this candida infection. And in the end, the long-term diflucan was a little bit more helpful. Reducing the sugar was a little bit more helpful. But there's just one other thing, Carolyn. So, there was no doubt I had a candida infection because they found it. I mean, they saw it growing under a microscope. Candida is it's round circles. So a doctor will generally just do a smear. They'll use a Q-tip or use something to gather a little bit of fluid, put it under a microscope, and you can see the little circles. And yeah, it looks like microscopic grapes. Once they see that, there's no doubt you have a fungal infection. You don't even need a culture for that. If it's very stemmy, like it's a stem with a circle at the top, that's a sign that it's Candida glabrata, which is a particularly virulent candida, and that's what I had. So if it's stemmy under a microscope, it's probably Candida glabrata. So anyway, as they were trying to treat this for me personally, and I was doing all this diflucan, they always prescribed, in addition to the diflucan, a little bit of nystatin cream for my skin, and I never used it because I honestly thought diflucan killed everything. So it's like, I don't know why you're giving me this cream, but I didn't understand the importance of it. And boy, was I wrong. And I had a wicked candida flare. It was so painful. I thought that I had ruptured an ovary. I mean, I was at urgent care with this agonizing pain. And they do a sonogram. Ovaries are fine. They go, oh, we need to look up there. So drop trowel, put the gown on, get into the stirrups. The doctor comes in, takes one look, and he goes, wow. Jill, I can see the candida burrowed into your skin. I mean, it's just, I can see it right here. You're covered with candida on your vulva. Aren't you using the cream? And I went, no. And he said, Jill, the reason why we gave you the cream is because the diflucan does not arrive in the skin of the vulva in significant quantities to kill the candida. The diflucan will kill it in your bladder, but the blood supply is so limited in your vulva, it just doesn't get there in enough quantity to kill it. That's why we gave you the nystatin cream. And I'm like, well, it would have been nice if somebody had explained that to me. And this is with a degree in pharmacology drug development. I did not know that. And so they reordered the nystatin, and they gave me a combination of nystatin triamcinolone. So it was the antifungal with the steroid. And that, in the end, is what got rid of it at the end. I mean, so we got rid of all the candida on the inside of my body, but we didn't deal with the candida on the outside of my body because I wasn't using the frickin' cream. I did not know that. You know, we all have to have a lot of humility as we get older because there's so much about the human body we just don't know. And I did not know that. So Caroline, that would be the other thing that I would have them look at is your skin down there. Because the oral diflucan might not be enough. Danielle said, I was told at the end of January I had a yeast infection and bacterial vaginosis. He gave me vaginal clindamycin and diflucan, but I'm allergic to that because I'm on methadone and I can't mix it together. I never could go back to see if it was eradicated because the doctor left the practice. So now maybe I have yeast. Maybe I don't. I just deal with it and eat a lot of yogurt. Well, you know, Danielle, certainly you've got a gynecologist. Just make an appointment at the clinic with a new gynecologist and have them look and just say, listen, I was diagnosed with yeast in January. I don't know if I still have it or not. Can you take a quick look? Caroline said, mine is on the inside. It's a hot feeling. See, Caroline, I never had external symptoms. All of my pain was inside. I had no clue, no sign that I had candida on my skin on the outside. My symptoms were vaginal symptoms. And so I was stunned. I was going to say, God, it had a unique feeling. There was a weird symptom that I used to get with the candida. It just kind of flew in and out of my brain. What was that? I will tell you, it was the most severe pelvic pain I've had in my life. You know, I had bladder pain before. Listen, having fungus in your bladder, 10 times worse. I was like, it was absolutely a Vicodin moment. The pain was insane until we got that out of control. And that's, Danielle said, it feels like you're straddling a curling iron. Yeah, that's fair. That's fair. I always said it felt like somebody had rubbed my skin off with sandpaper. That's how I describe vulvodynia. But I didn't have a lot of vulvodynia with my candida infection. And the other thing that was really surreal is I never had a discharge. You know, they always say if you've got an itchy vaginal discharge, that's a sign of bacterial vaginosis or it's a sign of yeast. I never had any discharge with this Candida glabrata infection. Never. I once had a little bit of blood, but never, they say, does it smell? Is it like cheese curds, anything like that? I never had it. And Caroline said, no discharge or itching. Exactly. And Danielle never had any itching or discharge. Exactly. It's just pain. And the pain was insane. So anyway, diflucan, just to summarize, Candida is getting very good at defeating antifungals. There are some Candida infections now that are diflucan resistant. And so we've got to attack candida in many different ways. Number one, we have to stop feeding it. We've got to make sure that you're not sitting on any hot cushions in your car. Anything that would add heat to that area in between, on your vulva, should be avoided. Absolutely. Using those topical creams were for me that last piece of the puzzle that got my candida under control. Caroline says you were shocked it was you. So was I. And see, the thing is now you can do next generation DNA urine testing. Next generation DNA testing of a vaginal swab. And that's a really good way to see if you have active candida in your vagina, because a typical culture will not see it. And generally, the way doctors normally prescribe yeast is they take a swab and they look at it under a microscope and they look for the little round things of fungus. But that next generation DNA testing will identify the species, it will identify drug resistance genes, and it will give you a much clearer clue of what could be causing some of these symptoms. Danielle says, for me, it burns, but I also have a dull ache in the perineum that I described earlier. So I think I have two issues going on. Now, that perineal pain is often nerve pain from tight muscles. It was for me, for sure. So I agree. You probably do have two things on. And you're wondering if I sell pillows that go between my leg. No, but we sell ice packs. Let me see if I have one here. Hold on. We had some fabulous ice packs that were the shape of a menstrual pad that you could use. You always have to wrap it in like a washcloth. You should never apply ice directly to your skin down there, because you don't want the ice to attach to the skin and you have to pull it apart. That would be a bad thing. Here, hold on a sec. Let me look and see if we still have them or not. So what some people do is they make their own ice pack, and I'm trying to remember how they do it. You could use a really clean sock and put some ice cubes in that. Hold on, let me see if I still have them. Yeah, I do. They're called Mama Strut. They're called Mama Strut. These are perfect cold pack. This is exactly what you're looking for. Oh, I'm so glad we still have these. I'm not up in my warehouse, much. I will be back there more, but I was caring for my parents, and so they were making decisions about what we were going to carry. And so sometimes they cancel things and I didn't learn about it. But anyway, the Mama Strut heating pad. Let me give this to YouTube too. What's the link here? heat-cold_pads. Let's see if that works. We have some great big microwavable heating pads too. Love them. Diane says, my uro told me to drink when thirsty and not to concern myself with getting 64 ounces a day that is recommended. Said there's no real research that we need to drink a lot of water, that if we were told to eat all the time, even when not hungry, so always full, we would think that this was not, he's right, hon. Ultimately, you have to look at the color of your urine. If you have clear urine with no yellow, you're drinking too much water. If you have dark yellow or brown urine, you're dehydrated. You're not drinking enough. If your urine is a pale, clear yellow, you're perfect. I mean, I usually drink 1 or 2 of these a day. That's what I drink. Betsy says, how do you set up a consultation with me? Betsy, you just call that number, which I know is reversed for you guys. There you go. You can call that number during the week. And I answer the patient education phone line and the corporate phone line. And if I'm available, I'll answer the phone. If I'm not, that means I'm usually working with somebody. Leave a message and I'll call you back. Okay. And if you just want to, if you want to do a couple of questions, not a problem at all. If you want to spend a lot of time going over your history, then you can sign up for a coaching session. You guys, I work with patients every day, almost all day. 9 out of 10 of those are completely free. I don't turn anybody away. I don't. I just can't do that. But what I will tell you is the patients who sign up for coaching always get first dibs because they paid for it. And so you can sign up for coaching in the IC Network shop. It's $50 for 30 minutes. But again, I don't turn anybody away. If you can't afford that, don't worry about it. You can call anyway, and I will still talk to you. But I have bills that I have to pay. So Zoe says, what is the most common cause when symptoms start overnight? I was completely fine one day, and the intense pressure and pain woke me up at night and never went away. Zoe, usually it's an injury. Usually it's some sort of injury. Number one, how old are you? And is there any event that you associate with the onset of your symptoms? Did anything happen that you thought played a role in your symptoms starting? Was it sex? Was it a vacation? Was it falling off of a horse? Was it falling on your tailbone? High stress? What do you think played a role in the onset of your symptoms? And also, just so you know, you guys on YouTube, you're on a 5-second delay. So we always have to have YouTube on a delay because there are bad people on YouTube who like to come in and mess with us. You're 26-year-old and you can't see anything that could be associated with the onset. So generally when symptoms start in your teenage years or in your 20s, we're really looking at injury. So are you an athlete? Are you a dancer, ice skater, horseback rider, bike rider? Are you an athlete at all? Did you do childhood athletics? And if you did, what was your sport? What was your sport if you were an athlete? And you guys, hold on one sec. I got to look at something really quick. This is probably going to slow down one of my streams. It's probably going to slow down the YouTube stream. So give me a quick second here. Just for a second. I just want to see where the hurricane is. So you can, if anybody's interested, see, I come from a family of pilots, and so my family loves planes. Everybody loves planes. My mom loved planes, so I always had her camped in front of my iPad watching plane flights live. And this right now is a live feed from Los Angeles International Airport. You can see the flag blowing. And so the high winds from the hurricane are hitting right now. That's a big Asiana Airlines A380. Yes, I know that stuff. So for anybody who wants to kind of watch the planes and watch the hurricane, you can go to YouTube and go to LA flights, and see it live. I'm going to turn it off right now. You're done. All right. Zoe said, doctors did notice mild constipation. Oh, wait, hold on a sec. I do lift weights regularly, but wouldn't consider myself an athlete. Ah, my dear. Yes. The dreaded weights on the pelvic floor. Yes, if you're doing machines, or you're doing anything where you bring your knees together or you're open your knees apart, that stretches your pelvic floor. But if you're squatting and lifting, that also stresses the pelvic floor. And so, when you injure your muscles, what happens is they get tight. And one of the classic symptoms of tight muscles is, hello, constipation. So you need to have a pelvic floor assessment. That should have been done at your very, very first appointment. If you haven't had that done yet, you need to tell them that you're a weightlifter, because the odds are you've hurt your pelvic floor. And again, with the sudden onset of your symptoms, it's not, remember, we don't think of IC as a bladder disease anymore. It is a neuromuscular disorder, that there's no disease process happening in the vast majority of patients. Rather, 85 to 90% of IC patients actually have very tight muscles. And so anytime we see symptoms that begin in teens or 20s, we're always looking for muscle injury. And you're doing like one of the things that we know will massively tweak those muscles, which is weightlifting. So if I were you, I would get a pelvic floor assessment, and let's rule that in or rule that out. Here's a website. If you go to pelvicrehab.com, you can search by your zip code, and you can find a physical therapist that is trained in a proper pelvic floor assessment. Now listen, when you go, the examination, this is a neutral set of eyes looking at your body. That's what we need. We need somebody to look at your pelvis, especially because you're an athlete. You're weightlifting. Okay. They're going to start externally. In your first appointment's your pelvic floor assessment. They're going to have you walk up and down a hallway. They're going to measure your legs. Do you have one leg longer than the other, which would tilt your pelvis and cause some pelvic floor tension? They're going to look for tension patterns in your back, in your core, in your glutes, in your thighs. They're just looking to understand the health of your muscles. And then they're going to ask to do an internal examination. And when they do the internal examination, it's the most important part. Nothing to be afraid of. You're not in stirrups. It's nothing like that. You're just laying on a table with your knees up. They're wearing a glove, a little bit of KY. They just stick a finger up your vagina. And all they're going to do is touch muscles. That's it. And if they can touch a muscle and trigger pain, that is what I call your hallelujah moment. That's very, very exciting. Very, very exciting, because you get to say, that's it. What are you touching? A healthy muscle feels like a raw chicken breast. A tight muscle feels like painful beef jerky. So what we've got to do is it's like a minute. Just let them touch muscles. And if they can touch a muscle and trigger your pain, that's very, very exciting. Now, why do they have to do it vaginally? Let me show you. Let me show you. So allow me to introduce you to your pelvis. Here you go. This is the front. These are your pubic bones. These are your hip bones, right? And you notice that the muscles are not on the outside of the bone. They're on the inside of the bone. Let's look at it from the back side. We've got your spinal cord, your vertebrae. We got your sacrum. We got your tailbone. I want you to look at everything that attaches to your tailbone. Your tailbone is at the very center of your pelvic floor. You got muscles that go to the left and you got muscles that go to the right. And sometimes for some patients, it's just one side. Like for me, it's my left side, not my right side. It's my left side. Now let's look at it from the top. So here's your pelvic floor from the top, and you can see that these muscles are sitting right on top of the bone. You see that? And the only way that they can reach the muscle is with a finger. See that? So this is what they're going to do. They're going to touch shallow muscles, medium muscles, and deep muscle. But when I say deep, look, it's just a finger width, and it's very benign, very easy, nothing to worry about at all. So we just want somebody to touch these muscles and see if they're in good health. If they're tight and painful, then we know what you need to do. You need to do pelvic floor physical therapy. Joey says, thank you, Jill. We'll be booking an appointment with a pelvic floor physical therapist today. Awesome. Betsy said, is hydroxyzine helpful for flares? Only if it's an allergy-induced flare, because hydroxyzine is an antihistamine. So not really. Hydroxyzine is one of those medications that you normally take every day over time that just kind of calms the allergenic process from happening. And it also has a very mild anti-anxiety effect. But for flares itself, usually not. If you're having remember, you got to differentiate between the type of flare you're having. If you're having a bladder wall flare, you got to do the bladder wall protocol. If you're having a pelvic floor flare, you got to do the pelvic floor protocol. And you can get those protocols when you come on over to the IC Network website and you sign up for our free newsletter. Your gift will be a 40-page flare management guide that has hour-by-hour rescue plan. So you can find a lot of information about IC flares right on our website, icnetwork.org. And sign up for that free newsletter so that you can get that flare management guide. Diane said, let's see here, hold on a sec. Danielle said, that is so weird that the West Coast is getting a hurricane. I'm not living on the East Coast my whole life. We always have gotten them. My son works at the airport in Boston. Yeah. Oh, it's a long way from us. It's actually, I can see the clouds over to the east now. The clouds that we had have receded. The hurricane is going east. So the hurricane is in the Sierras right now and hitting Nevada and Utah. It's not on the California coast, at least where I live. Diane says, does a series of Elmeron bladder installations help the bladder lining so I can be less restrictive with my diet? I've had IC since a child, and I think I do have widespread pain syndrome. It got a lot worse after menopause with estrogen atrophy. I've used vaginal estrogen since November of 22nd, and the skin down there is a lot better. But my bladder pain is better too, but I'm still diet sensitive. No. Elmeron is a coating. They used to use a little dump truck as their model in their graphics. It's like a little cement truck dropping stuff on the bladder wall. That was how they explained the coating effect of the bladder. But Elmeron is a very small molecule. So you have to have a lot of Elmeron that kind of builds up in whatever holes or concavities you might have in your bladder lining. And it will wash out. Do we have any data on permanence? I don't think that there's any data on permanence. I'm not aware of any study that tracked how long Elmeron stayed as a coating in the bladder. Maybe they did it. I don't recall ever seeing that. So to me, it makes more sense to do something with chondroitin, because chondroitin is a building block of the bladder wall. So rather than doing the Elmeron bladder installations, you could ask for chondroitin bladder installations. They were called Uracyst, Uracoist. They were approved up in Canada and Europe. Or Ialaril, which is a combination of chondroitin and hyaluronate, but neither one of those are approved here in the United States. So what we've got instead are the chondroitin-based supplements. So the Bladder Builder, I don't know if you've seen these or not. these are really going to be the top chondroitin-based supplements in my opinion. So Bladder Rest, and this is a kind of a starter formula, a very mild formula for people who are a bit more sensitive. Bladder Builder. Bladder Builder is, in my opinion, the best supplement on the market because it has the most methods of action. So it's got chondroitin for the bladder wall. It's got quercetin for the antihistaminic effect. It's got some beneficial probiotics for the gut. And it has PEA in it for nerve calming effect and pain relief. But the strongest chondroitin supplement that's a very popular favorite for patients with estrogen atrophy is Cystomend. And so I think that from a cost standpoint and not invasive, well, what the AUA said, the American Urology Association encourages the use of supplements before using bladder installations because they're not as invasive and they don't carry the same risk of adverse event. So I think the supplements are interesting. You can find them all on our website. Angie said, I have severe Hunners. I cannot tolerate any installations. I just became and Betsy, thank you. She just became a member. Angie said, I had an ozone treatment done by naturopath, caused intense burning and intense pain, did not work for me. However, my bladder wall cannot handle it. And Donna here says she loves Cystomend. So Angie, I would never have considered ozone for Hunner's lesions. However, we do have research that shows that hyperbaric oxygen therapy has been successful in treating Hunner's lesions. So a hyperbaric oxygen is you're just in a pressurized room that's very rich in oxygen. It's what they use for scuba divers who ascend too quickly and they get the bends. And so many hospitals do hyperbaric oxygen therapy for burn victims, for all sorts of different things. And hyperbaric oxygen therapy has been studied with Hunner's lesions and has been successful. Not big studies, but good sized studies that have shown some success. So that would be interesting. And let me see if I can find that for you. Here, hold on. Because I would like for you to see that research. Okay, well, the first thing that came up was the article that I wrote on it. So let me just give you this link here. And I'm putting that into our YouTube chat. And that has all the links to the research. 1, 2, 3, 4, 5, 6 studies that have used hyperbaric oxygen therapy for Hunner's lesions. So that's definitely interesting. We've got patients who are doing it right now. And I would Google hyperbaric oxygen so that you can see, the other things that it's used for. I would put that way before ozone therapy. That's for sure. All right, hold on a sec. Danielle says, I have a question because my doctor during a urogynecology appointment before he left, he asked me to point and touch where it hurt. So I did, and he said, you're pointing at your cervix, so I don't know what that entails. I will be going to get my first ozone treatment in my vagina, as I explained earlier in the meeting. I'm scared, but I'm also excited because I've lost hope for traditional treatments. I would love to talk to you on that. Yeah, Danielle, I'd love to talk with you. You're going to have to refresh my memory, honey. I talk with so many patients. But yeah, be happy to talk. Be more than happy to talk with you, okay? Diane says, I've tried Bladder Rest, Bladder Builder, Cystomend, and it made my bladder pain worse. I think because of bloating and gas pains mostly. What in the supplement causes these side effects? It may just be the chondroitin alone. Actually, it's the chondroitin. The chondroitin itself is any of the chondroitin-based supplements, all of them have been associated with bloating and stomach upset. And so generally what we always tell patients to, or at least what I always say, is don't take a full dose the first day, for God's sake, you're sensitive. try one capsule and do one a day for a week and just see how you do. If you do okay with one a day, go to two a day. See how you do. Do that for a week. You got to be very slow. Now, for me, as an example, when I tried Cystoprotect, which is the first generation supplement, that's the old supplement. Now we have these newer supplements. I could do one Cystoprotect, and I will say that my stomach always did a flip flop. I remember very distinctly standing in my bedroom window, looking out the window, which is kind of where I go when I just need to get away. And I had just taken it, and I had about 5 or 7 minutes of my stomach going, what did you just put in me? I don't know if I like it or not, but it did get better. So I was okay on one Cystoprotect a day. When I went to two a day, it gave me loose bowel. And I personally do not like having loose, messy bowel. And then, just out of curiosity, I tried three. I should have known better because it gave me wicked diarrhea. So, many of us are just sensitive. And I always go for the lowest effective dose. What's the lowest amount of medication I can take and get a beneficial effect? Danielle, thank you so much for the 100 stars. Really appreciate that. Thank you. Thank you. So, I think, Diane, how did you do when you did one? Did you have bloating and gas when you took one? I've never been able to take four. I would have been in the bathroom for a couple of days if I tried to do that. I was already in the bathroom taking three, but I was okay with one. Such is the fate of those of us who happen to be super sensitive. We are sensitive to stuff, overly sensitive to stuff, right? Now there was one. Okay, so remember, I'll stick around as long as you have questions. Diane said she only did one and she had bloating. Okay, then they're not for you. I know that some manufacturers would say sometimes you have to take it for a couple of days for your body to tolerate it. But you live in your body, you know what feels good in your body, and if it did not feel good, I would not continue it. But some of the manufacturers would say that you got to work through it. But I'm like you. I'm like, yeah, no, I'm very careful because I already know I'm super sensitive. So the bladder instills might be a better choice for you. A heparin lidocaine bladder installation does not involve anything going into your stomach that can cause any side effects. And again, ultimately, in the end, it's still about your subtype. We want to make sure we know what your subtype is. So if you're an estrogen atrophy patient, we've got to do the estrogen. If you're a pelvic floor patient, we got to do the pelvic floor physical therapy. If you're a widespread pain patient, we got to do the mind-body medicine, things that calm nerves down, right? Danielle, thank you again. Another 50 stars. She said, thank you for all that you do. Thank you for all that you continue to do to help others still learning how to send these. Oh, you're very, very welcome, hon. You're welcome. I love my job. I love being here. I do. It's my thing. It's one of the hard parts of life, especially when you're in your 20s, is figuring out what you're supposed to be doing. And I was always very envious of people who knew what they wanted to do in high school. Like my lab partner in high school, Anita, was just brilliant. Oh my God, boy, I couldn't have had a better lab partner. She sure inspired me. Became a doctor and a very, very accomplished doctor. She knew that in high school. I didn't know that in high school. And I think, it's not like we all get one job and we stay there for 40 years. I think today we understand that it's important to try to find something that resonates with you, that feels good. Physically, mentally, and emotionally. It's about finding where you belong, finding something that helps you thrive, finding something that makes you feel good. So like in my family, my dad and my mom was be a teacher. But I was already having bladder issues then. And I took the teacher's test and I got a perfect score. So yeah, I could have become a teacher and I'm teaching right now. But I didn't want to deal with the restroom access in school. My dad was always work for the government. And I tried working for the government and it sucked my soul dry. In the end, nobody can tell you what the right career is for you. You've got to just try a lot of stuff until you find something that feels good. And this feels good to me. So I'm really happy to try to help. But I always qualify it. I'm not your doctor. I don't give medical advice. My job is to educate you, inform you, open up some new windows, open up some doors, and then give you a necessary kick in the butt to get back to your doctor to talk about some of the things that we've talked about. And that's challenge here because medical care has really changed and um it's kind of like when antibiotics came along, doctors were just like, here's an antibiotic, get out of my office, right? God forbid you have any urinary issues back in the 60s, 70s, even 80s, boop, here's an antibiotic, send you on your way. And I think, and then throw in the fact that you're a woman, it's all in your head. Or you might get the proper hygiene letter. Oh, aren't you wiping correctly? You're supposed to wipe from front to back, not back to front. Like, I'm 6 years old. I know how to wipe my butt. I know, just this constant, like, not taking us seriously. And we have to be, even though you're feeling miserable, this is the time when you have to stand up and be counted. You have to advocate for yourself. You have to read. You have to learn. Your doctor is not better than you. Your doctor is not worse than you. Your doctor is your equal. And when you walk into that doctor's office, the last thing I want you to do is to burst into tears and not be able to talk about it. I need you to walk in and say, all right, doc, here's the issue. I'm getting up 4 times a night. I have pain when I sit down. It gets better when I stand up. Or I have pain on the left side. Whatever. You got to be able to clearly talk about your symptoms. You need to know your structures. Like so many women, they don't know where their urethra is. Come on. Seriously. Have you looked at your body? And it's shocking to me the number of women who feel that their body is shameful. Your body is not shameful. Your body is a gift from God. The human body is amazing. Did you know that the cleanest part of a woman is her vagina? Because that vagina sloughs off its skin every 5 hours. That's one of the defenses that the human body has to protect women, because of sex. And so I want you to drop trowel, squat over a mirror, and look at your body. What does it look like? You need to know what healthy skin looks like. You need to know what your normal is. Like, I'm red down there. Every doctor's like, wow, you're red. Is that normal? Yeah, it's normal. I'm red. Like, you're dark red. Yeah, I know. I always am. That's normal for me. Right? So you need to know what is normal and you need to know what's abnormal. And it begins with looking at your body for the miracle that it is. It's a blessing. It's keeping you here. We want to do everything we can to give your body everything that it needs to be healthy. Betsy says here on YouTube, what are your recommendations for constipation? Fiber. You need to eat 20 to 25 grams of fiber a day to be healthy. So again, I have no shame. I'll talk about anything. I use myself as an example. I had IBS in my 20s. It's gone now, but I had really bad IBS in my 20s. Oh my God. I called them bend over and screamers. Every morning, 11 a.m., bam, I'd be laying in the fetal position on my bed or in my bathroom. The pain, cramping was so bad. And that turned out to be food sensitivity to oatmeal. Everybody's telling me to eat oatmeal. I ate oatmeal. Oh my God, it just made it worse. And when I stopped eating oatmeal, all my cramping went away. So we all have very interesting food sensitivities. So anyway, IBS was kind of a hot spot for me. It was very protective because I was very traumatized by it. And several years ago, I was struggling with a lot of rectal pain, a lot of rectal pain. Sitting was hard. And I was passing rocks. I was passing rocks. I was not, they always say a healthy bowel movement basically looks like a big, thick noodle. And when it drops into the toilet, it curves into an S shape. That's considered a perfect bowel movement. That is very elusive. That might happen once a week for me, you know? I was at that time passing rocks, little hard stools. And the rectal pain was insane. Yeah, I was like, oh my. And so I kept going to I wouldn't go talk to my regular doctor about it because he was a young man and I was too embarrassed. I always made a same day appointment with a woman so that I was just goofy. He chewed me out. He goes, Jill, I have he said, I have inflammatory bowel disease. If there's anybody you can talk to about diarrhea in your bowel, it's me. I didn't know that. Anyway, that's a side story. So what we found was that number one, I had a hemorrhoid. And when you have a hard stool and it sits on a hemorrhoid, it hurts. I had a little tiny hemorrhoid, but it was on the nerve. So anyway, I made an appointment with an IBS specialist. And that IBS appointment was absolutely the best doctor appointment of my entire life. She was insane. She was so good. Went over my history, went over everything, explained everything. Love her, love her, love her. Well, she said to me, she goes, Jill, how many grams of fiber are you eating a day? And I went, I have no idea. Nobody's ever asked me that question. Nobody's ever asked me that question. And she goes, well, for you to have a healthy bowel movement, you need to eat 20 to 25 grams of fiber a day. And I went, well, I'm sure I'm eating a good diet. I mean, I eat good, healthy food. And she goes, go home and count it up and email me. I go home, count it up. I'm eating 6. On a good day, I'm eating 6 grams of fiber a day. And then she gave me a fiber chart and she said, okay, here's the fiber chart. Here's the foods that are high in fiber. Get it up to 20. And when I got it up to 20, it was amazing how much better I felt. It was like the rocks were no more. So when you have hard stool, that's a combination of not enough fiber and not enough water. So we got to increase the fiber, increase the water a little bit. So I always make it a point. I have at least 1 serving of green peas a day, or beans a day, or every other day, refried beans, because I am very invested in keeping things moving. I do not like having hard rocks. Now, Danielle here says she gets in severe impactions where you have to have gloves nearby, but I've learned to live with it no matter how much water I drink. So Danielle, I have that too, but I don't get, this is what's interesting for me, is I don't get severe impactions. What happens for me is that, you normally have your big bowel movement in the morning, right? But when you're going to bed, that stool is starting to move into your rectum. I have a very, very sensitive rectum because of that damn hemorrhoid. I feel anything in my rectum, anything. It can be the size of a pea. It can be little, it can be big. If it's touching that freaking hemorrhoid, I cannot sleep. And that is why I have gloves and KY in my bathroom. I don't I don't waste any time anymore. If I feel it, even as I've got my pajamas on, I'm getting ready for bed, go to the bathroom one more time. I always just stop and go, okay, do I feel anything? If I do, and it's always there, I just put on a pair of gloves, flick that sucker out in 2 seconds, and I'm done and I can sleep okay. So the severe impactions, we call it packing, often happen when you've got the rocks. That happened to me a few times, and that's kind of an enema moment where you've just got to get some water up there to try to move things along. I found for me that once I got my fiber up, all that went away. And so normally for me now, I've kind of got it down to a science. If I eat well the day before, I'm going to have a good bowel movement in the morning, and it's as close to normal as I'm ever going to get. You know, I mean, it's very close to being normal. It's not painful, comes out, everything's good. But it's just that little legacy of nerve sensitivity that drives me crazy before I go to bed. And so I don't carry any shame about those loves and KY. You'd be amazed at the number of people who do that, and I'm not worried about it at all. So Betsy, 20 to 25 grams of fiber a day. Give it a shot. I happen to love green peas, so I'll do hot peas, like 1 cup of hot peas, 16 grams of fiber. You can't go wrong with green peas. I mean, it's a soluble fiber, it's gentle, it gets the job done. Danielle says, I know this sounds weird too, but sometimes I can't even tell if there's anything in my rectum unless I go up and check manually. I find that to be unusual within itself. Well, Danielle, it actually kind of sounds like you have a partially compressed nerve root. I have had moments when I have felt nothing. I mean, I had no clue that there was anything in there until I finally went to the bathroom and it's like, oh, I could actually have a bowel movement now, which is good. That's better than the cramping I used to have. But, you know, you got to do what you got to do. Betsy says medication is causing constipation. Yeah, certain medications are well known for causing constipation, such as an opiate. But there are medications. If you're on opiate pain medication, there's a medication that they can give you which will block that effect. Let me see if I can find the name. Relistor, Relistor, Relistor. Yeah, try the peas, hon. I do hot pea. You know what? You can make a great cold pea salad. You know, I just do a whole pack of peas, microwave for 5 minutes. I'll eat one and a half cups, and then I save the rest for the next day. You know that you can make a really good cold pea salad with chopped celery, mayonnaise, a little bit of chopped onion or chives, a little bit of chopped carrots. I mean, it's a Scandinavian thing that I grew up with in my family. I love cold pea salad. It's so good. Or, you know, if you happen to like hummus, hummus is garbanzo beans, ground up garbanzo beans. That's a good way to get beans. We have a great a store that makes hummus and falafel, a restaurant called the East West Cafe. In fact, that sounds good for tonight. We will see. I love falafel and hummus. Danielle said, I have myself extremely depressed because I've lost 110 pounds without knowing why. I've shrunk my stomach. I stopped drinking soda, vaping. All I want to eat is a half a bacon double cheeseburger and some chicken nuggets or a pot pie. I'm lucky if I eat 500 calories a day because I'm depressed and I don't want to eat. Well, Danielle, you need to be working with a professional, hon. You need to be working with a professional because they have to really help you understand what your brain is doing that is causing this. I mean, is it a bad memory? Is it trauma in your history? And we need to make food safe again. There's nothing. Listen, I'm always surprised when people say they're afraid to eat when they have IC. There are so many foods that are IC friendly that do not irritate the bladder. The vegetable aisle is your friend. I mean, like literally. Okay, here's an idea. Do a baked potato and get yourself some uncured bacon. Uncured bacon. So cook the baked potato, cook the bacon. When the baked potato is done, obviously open it up, put some butter in it, put the bacon on top. Maybe you could put some cheddar cheese on top or Parmesan cheese, even broccoli. Listen, that's completely IC friendly. That's comfort food for me. Karen says, I have Hunner's lesions in my bladder, diagnosed in 2013, now getting steroid injections in my bladder. Good, Karen. Karen, the nice thing about steroid injections into Hunner's lesions is it has a good track record of success, doesn't leave any scar tissue. So how are you doing? Are they responding to therapy? Karen says, my bladder capacity is 200 ml. It's pretty small, but not terrible. She says, you currently have suppositories with pain and muscle relaxers. I inserted at night and it has made a big difference in pain management and sleep. So Karen, the fact that a muscle relaxant is helping you sleep kind of proves that you've got some pelvic floor stuff going on. So Karen, we've got two prevailing theories on what causes a lesion. Number one, that it could be a virus, a viral infection. We found Epstein-Barr. We found a lot of different viruses in the urine of patients with Hunner's lesions, not in patients without Hunner's lesions. But there's another one that's really quite interesting, and that was a woman who had severe Hunner's lesions, and she had a severe prolapse. And her prolapse was so bad, they decided they needed to surgically repair it. So when they went in and opened her up, they made a remarkable discovery that her uterus was facing backwards. The front of her uterus was facing backwards. The back of her uterus was facing frontwards. And that is because one of the ligaments had broken. So her uterus was free swinging on one ligament. And it had caused what we call a strangulation injury. It was just free swinging there. And that was twisting all the nerves and blood vessels. So something remarkable happened, and that is when they untwisted it and they got everything back in its right position, her Hunner's lesions healed completely. She is considered a complete and total cure. And that supports our second theory of a Hunner's lesion, that it is a nerve that is massively inflamed. So she went from 3 lesions down to 1. Then you missed your 3-month injection. Then you went back to 3 lesions. So now we'll never miss an appointment. So Karen, it would be perfectly reasonable for you to ask for a viral blood test. Let's just see if you happen to have any active viral infections. If you go to the IC Network website and go into our virus section, you can read about that. But that's proven research. And in fact, just 2 months ago, we had another viral study where they found the Epstein-Barr virus using next generation DNA testing in patients with Hunner's lesions. And for the first time, they tried an antiviral therapy and it worked. So this is not this is not an unsupported theory. We've got multiple research studies, including our own National Institutes of Health. The European research came out 6, 7, 8 years ago. There are multiple studies that found the polyoma virus and the Epstein-Barr virus in the urine of patients with Hunner's lesions. So we're reading all this research, waiting for our government to respond, our research team to respond. And for years, they said nothing. And I'm talking to these researchers on the phone going, guys, what do you think about the viral finding in Hunner's lesions? And they were suspiciously quiet. Well, what I didn't know is they were doing their own viral study where they have, as part of the IC research, the MAP Research Network, they have the urine of patients with Hunner's lesions over time. So they went back and they started studying that urine. And what do you think they found? The polyoma virus in patients with Hunner's lesions. And the polyoma virus is well known to be associated with hemorrhagic cystitis. This is a virus we all have. It just gets turned on in patients who are immune compromised. So hemorrhagic cystitis is common in patients who are on anti-rejection drugs for kidney transplant, or who have HIV or AIDS, or have any sort of autoimmune issue. The virus gets turned on in the bladder. It causes an ulcer that bleeds profusely. So it would be very interesting to see, just do a very simple viral test to see if you have any active viral infections or any markers for past viral infections that could be playing a role in your Hunner's lesions. Karen said, doctors recommended performed a complete hysterectomy in 2013, but that was now not your problem. Had asked if I could have a ligament issue. We'll ask for a virus test in my next. Good. Got nothing to lose. Go for it. And that's very common. There's a very high rate of completely inappropriate hysterectomy in IC patients. Diane Manhattan, who helped me found the IC network, had her hysterectomy at like 21. It's just brutal. She would have been a fantastic mom. And we've had major settlements paid out to women who have had completely inappropriate hysterectomy. Hold on a second. Danielle says, I'll either eat a pint of ice cream to try to make up for those lost calories because I could tolerate it and it could also soften my stool. Well, I don't know how ice cream would soften your stool. What about almond butter? Can you do almond butter? And you do have a lot of childhood trauma. I think I'm afraid to eat because of pooping and knowing how painful it is. I know that sounds really weird, but I do suffer from PTSD. Plus, I have a spouse who also liked me 240 pounds. And now that I'm 140 pounds, I feel unwanted as I sit here crying. Isn't that's very common. It's I don't understand why, because normally you would want your spouse to be healthy. I would guess that is your spouse also heavy? And now a little frustrated that you've been able to do the work that he has not been able to do the work to lose the weight? But honey, you're wanted. And listen, this is your body. You get to live in this body. You get to decide what feels good. If you feel better thinner, then stay thinner. If you feel better a little bit heavier, then you can stay a little bit heavier. But it's your body. You just have to understand the risks. There are risks to gaining weight, diabetes. And so, I mean, the gift here is you're older, you're wiser, you're smarter. You're not a teenager anymore. You're not, you understand that drinking soda all day is going to be an issue. Drinking diet soda all day is an even worse issue. And so what I would just say to you is, listen, the past is over. It's done. We can't live in the past. And we can't predict the future. All we have right now is today, at this very moment. What can I do right now to put my body, my heart, and my soul in a better place? And so every day, I just need you to ask yourself that question. What can I do to help my body heal? What can I do to lift my spirit? What can I do today that will ease some of my worries? And little steps, not big steps. Nobody is telling you got to do big, giant things every day. This is about building a slow foundation of small successes, small but steady successes. And so if you can just eat one or two new things a day, knowing that we're just trying to get you as healthy as you can possibly be so that you can spread the love of you to the world, because you're here for a reason. I firmly believe that we're all here for a reason. There are people who need you. Danielle says, weird you should say that about a uterus. My late mother, who I lost at the age of 61, had a tilted uterus. Yep. Diane says, what helps if you wake up 4 to 5 times a night to urinate? Well, Diane, that nighttime urination is often a direct reflection of something that you've eaten that day or drunk that day. And so concept number one is look at what you're eating. If you're having a cup of coffee a day, a green tea, black tea, if you're taking a multivitamin, that's why you're getting up at night. And Diane says, I have a uterus that's tilted back, but has always been that way. Is that the same thing? There's a difference between a tilt versus a detachment of a ligament. If it's a ligament, then it's free swinging and it can twist. So it's either tilted or it's swinging. Very different. Well, so Danielle says it's almost like we switched. Like when you were 240 pounds, he was 145. Now he wears my old clothes and I wear his. It's crazy. I think that it's we have to think about what do we want our life to be like in 5 years, in 10 years, in 15 years. And I think that we have to have a plan. You can't just fake it, especially if you're not happy with where you are right now. You have to ask yourself, well, how would I change it? What would I do to change my life right now? And I think as a couple, there has to be a lot of discussion about what would you like to be doing in 3 years, 4 years, 5 years? How do you see your retirement? How would you like to be living? And ultimately couples really mesh when those goals mesh, It's like there are some people who, when they retire, they just want to travel. I am not one of those people. I have no interest in traveling. I want to be home doing art and crafts. I'm a homebody. I'm not a traveler. And it's interesting because I did just lose my parents, and this grief is like crazy. I mean, literally, I still cry every day. I'm just not sobbing, but I just like they're gone. It's so weird that they're gone. And I cared for them for so long. So they made it to 194. Oh, and they loved each other deeply. They went through some stressful times, but that love was there to the bitter end. Literally, I have on my phone my dad's last video for my mom telling her how much he loved her, and my mom's last video for my dad telling him how much they loved each other. But this is what I know, is that they talked a lot when they were younger about how they wanted to live. Like my mother was flat out, I don't want any yelling in my home, period. None. Because her mother was abusive. My grandmother was a yeller. That was a no pass point for my mother. And do you know, I only heard them yell once in 62 years. Once. And when I think about, when they hit their 80s and their 90s, because when you're in your 90s, you lose a lot. You can't drive, you can't get out, you can't do the things that you want to do when you're younger. And yet in the end, they built a home that they wanted to live in and be in for the rest of their lives. It was clean, it was warm, it wasn't dirty, it wasn't messy. And it was a very clear negotiation between the two. And so there's no substitute for you guys sitting down and just asking, okay, what's going on now that I would like to see change in a couple of years? And then working slowly to make that change. Diane says, let's see. I know you mentioned histamines as far as bladder issues. I was prescribed 3 different types of histamines, all of which I was afraid to try because they made you sleepy and helped you not pee as much at night. But I didn't want to mix it with the other sedatives I was on. I could tell you the name. So Danielle, you should. I want you to research this. It's called Mirbitriq, except there's no U at the end. I just misspelled that. Get rid of the last letter. Mirbitriq. So Mirbitriq is a medication for frequency urgency that is not an anticholinergic. is not associated with the side effects of the other antidepressants and stuff. So that might be that might be an option for you to try to help your symptoms. And Danielle says, my partner and I both have autism spectrum, different parts. Yeah, we have that in our family too. We have a lot of Asperger's in our family. My brother definitely. My sister and I, maybe tiny bit. I think the reason why we stay together is because we know nobody else wants either one of us. Sadly, I'll be 50 and he will be 41, and we've been together 7 years. Yeah. Well, age doesn't matter. It's about it's about your connection. And bullshit on nobody else wanting you, hun. I call bullshit on that. You just haven't met them. I mean, I believe that 100%. Diane says, I want to travel, but IC makes it more difficult. I will do it though and figure out how to do it. We have a lot of articles on our website on traveling, okay? How to make traveling easy. Like you could do a cruise. I mean, the problem with cruising is you just eat too much, but that would be reasonable. Danielle says, just Asperger's syndrome. He's definitely more as a Berg syndrome. My partner, mine, mild autism. My son is 30, but they got early intervention. Right. Okay, let me come back to YouTube here. Karen says, I have low blood pressure on standing with increased heart rate on standing. You have been aware of POTS, and this causes poor blood flow to my abdomen. Is there any connection between POTS and bladder wall lesions? Not that I know of. Not that I know of. Diane, yes. Yes, definitely. All right, you guys. Well, we've been doing this now for 3 hours. So I'm going to do a last call for questions. Last call for questions. Because my throat is starting to give out. Last call for questions. Karen says, thanks for all your support. You're very, very welcome, Karen. Always happy to do it. And please come on over to the IC Network and sign up to get our free newsletter and or become a member. I think you already said you are a member. Because I put my really good work into the magazine. And the articles, half of the articles in the magazine do not come out onto the website. Danielle, no apologies needed, honey. None at all, girl. None at all. No worries at all. All right, you guys. Donna. I hope you're good, Donna. I will talk to you later. So my plan is, okay, hold on a second. Let me look at my calendar here real quick. All right, so I am wide open next week. Yeah, baby. Woohoo! I'm going to be working on our master class on IC. So anyway, I am wide open next week. Mondays are normally my day off, but I do answer the phones after 2 o'clock. So if you want to call, don't hesitate. Be happy to try to talk to you. And yeah. Yeah. So, but the following week, I'm getting a little booked. So, all right, you guys, I will see you later. Be well. I'm going to say goodbye to Facebook first. All right, YouTube, I will see you guys later too. Be well.